welcome to CHI Innovate 2024. In the audience today, together with our guest of honor, Minister Grace Fu, of course, lots of people. Professor Joe Sim, the Group CEO of NHG, welcome. Professor Eugene Fidelis-So, Deputy Group CEO for Population Health, and also the ED for CHI. We've got two Deputy Secretaries from MOH here, Mr. Philip Cole and Mr. Anthony Tan, members from the TTSH Community Fund Board, the NHG Board, leadership from all three clusters. Thank you all for showing up. Our CHI Council, there you are. Our CHI partners, fellows, and friends. And all of you, ladies and gentlemen, thank you all for coming.
Yes, thank you indeed. We are sold out yet again. I mean, we like to take credit for it. I think you come to see the double act, right? Oh, no one responded to that.
No, they've never
heard
of us.
To the content.
They've never heard of us.
Sold out yet again. There are 800 people attending. We are delighted. Please give yourselves a lovely round of applause for making time for this. Thank you.
So it looks like we've hit on a raw nerve. A lot of people are interested in sustainability. That's very heartening. This conference was only made possible by our great sponsors and exhibiting partners, 30 of you this time, and you'll see them all at level 2 floors down at the exhibition hall. So thank you to our sponsors and premium exhibitor, MSD Pharma Singapore, and our knowledge partners, Accenture, who are hosting some of our attendees at their Singapore Innovation Hub yesterday, HOK, who will be hosting a lunchtime talk later this afternoon on sustainable design and healthcare architecture and future trends of hospital design, and OCBC, who at 2 to 5:30 today at level 9 upstairs will be hosting a talk titled OCBC One Connect Chinese Health Tech.
So there's so much to look forward to just today. We'd also like to give very special thanks to our ecosystem partners, Singapore Pools, Workforce Singapore, as well as the CHI Startup Enterprise Link, otherwise known as CHISL. We do love an acronym, right? Our awardees and finalists will be pitching their solutions to you over lunch at level 2 exhibition hall tomorrow. So that's something to look forward to. We'd also like to thank our premium exhibitors, GP Batteries, Zulka, and AWS. And finally, maybe more importantly, I don't know, I love ice cream. Thank you once again to National Healthcare Innovation Centre, who are sponsoring ice cream in the snack breaks today. Yes. Keep us all cool. Apparently also popcorn this year.
Ice cream and popcorn, and they're the only ones that got some applause just now from the audience.
Yeah, I know. And also I have to say, you and I usually miss out on those treats.
So could we save a portion of ice cream and a bucket of popcorn for Tamsin and I?
Okay, look after as well. So thank you. We have a lot to look forward to.
So this conference is brought to you by the Centre for Healthcare Innovation, or CHI. We operate and collaborate fiercely out of the NHG cluster, and we've been very generously supported by MOH, as well as the inṋovateInn Healthcare Improvement Fund, as well as, of course, the TTSH Community Fund as well. I think there's no better time than to bring on my partner in some crimes, not all crimes. He happens to be both the GCEO of NHG for Population Health and also the Executive Director for CHI. Please welcome Eugene Fidelis-So.
Mr. Grace Fu, Minister for Sustainability and Environment, Professor Joe Sim, my boss, Group CEO, National Healthcare Group, all our wonderful partners in the room, as well as colleagues and friends of CHI. Well, welcome to CHI, proudly hosted by the National Healthcare Group and also the inṋovateInn Healthcare Innovation Program. We are glad that you have joined us today for CHI Innovate 2024, where we are proudly presenting the theme, Sustainability in Healthcare. This theme is a reflection that the climate crisis is also a health crisis. And that is something we should take seriously and work together to avoid. And that is something that we want every effort to count. Because we know that the first rule in healthcare is to first do no harm. And that is something that we are proud to feature here today in this year's CHI 2024 conference. We have 800 participants in this conference, way over the capacity of this auditorium. So please also acknowledge those who are in Kampong Square watching this live, as well as the CHI halls below, because they're really joining us in this amazing program that we have today. But if you have some time, please walk around the building, because we have some amazing demonstration projects in sustainability across this whole wonderful facility we have, from upcycled wood to even a wind turbine on level 4, where it powers the whole electricity for all our landscape lighting out there outside of this building. As well as a solar umbrella. And if you have time and you want to exercise a little bit, there are energy bikes where you can pedal power our way to some of the electrical use for this conference. So please enjoy our hospitality as you are here with us today at the Center for Healthcare Innovation. CHI started as a little red dot. Then in 2016, we started as a co-learning network of 21 partners from across our health system, working very closely with academia and industry, as well as our agencies, in order for us to change healthcare. And we have since grown as a network to include now 91 strategic partners from across the world, working with us very closely in order to improve health for our populations. We have also a leadership council with us today, and I have the privilege of hosting all my colleagues on the leadership council. Thank you very much for your support. Yoran, Jonathan, Chachai, you have been with us since day one of the formation of CHI in 2016, and you continue to give us wonderful learnings. And we have also now Hari, Junette, as well as John T, and Sharif, who is our new council member. And of course, we have YY Teo from the School of Public Health working with us to co-learn and co-create the future. We also have our young leaders called CHI Flying. They have partnered from across our health system, working very closely with the National Youth Council, as well as onboarding social care leaders as part of our network. And together, they form about 90 of them today, and working on projects from population health to sustainability. In fact, they are running the Innovation Challenge today for sustainability. So support our young leaders, because they are the future that we all care about. Last but not least, we have the Hospitals of Singapore Network. We have brought together all our hospitals in order for us to build the future for hospitals together across our ecosystem. So we're very excited that we have all our networks here with us at CHI Innovate, and we're looking forward to wonderful collaborations and co-learning together. CHI has also expanded our support for all our networks, and we have been able to invest very heavily through the generosity of my boss, as well as the Ng Teng Fong Innovation Fund, that allows us to be able to provide a rich ecosystem where we can drive innovation together as one community. We have also collaborated with centers across the National Healthcare Group, and as well as partners, our main partner, NTU, and the Lee Kuan Yew School of Medicine, working very closely to translate research into innovation and to transform our workforce across allied health, nursing, as well as working with our patients and our patient volunteers through the Center for Health Activation. We are also deepening our roots across our ecosystem, working across all our campuses to embed CHI in every of our campus that we run and operate as the National Healthcare Group. And we are spreading innovation to ensure that innovation is not something we just talk about, but innovation is something we do that matters for our patients. We are also building platforms for rapid deployment. So the one that we have today is the CHI Living Lab, where we do rapid prototyping. We are also in the midst of setting up our XR lab, and we are also going to launch our AI deployment and adoption lab, HIL, coming up later this year. All of this matters because innovation stacks up to transformation and change. And the academies brings together various partners from our ecosystem, as well as the faculty from across our various partners in order to drive transformation. And that is what the academies do, and I will share more with you in a later slide. Well, but behind CHI are really the people. And this is what makes an innovation network works. The people in CHI actually is really the whole engine behind what we do every day. Because sometimes the hardest piece to change is not the technology, it's not the process, but it's all of us. And we need to work together to make innovation happen. CHI started with a mentor model that we can bring together our innovation efforts across care redesign, technology adoption, as well as workforce transformation and job redesign. This we proudly call our innovation cycle. And you will notice the National Healthcare Innovation Medals that is coming up later. It is built around this theme of how we can bring together all our collective efforts to ensure that innovation is able to sustain, able to spread, and able to scale. What is coming up is the idea that we want to stack up our innovation in order to drive transformation and change. That happens at 3 levels of our health system. One, at a care level, where we want to provide greater value for our patients. At the system level, where we want to go upstream to work very closely with social care in order to influence the social drivers of healthcare utilization. And we want to see the change in order to drive the health of our population, keeping them out of our hospitals and keeping them well and healthy within the communities. Last but not least, we want to work at the ecosystem level, where we are able to first do no harm to our planet and very much ensure that a healthy environment means a healthy population as well. So in order to do that, what we are really joining up is the iron triangle of healthcare to the triple aim of population health, to the triple bottom line of sustainability. So these are now represented by the CHI academies in order to drive change at all the various system levels, such that we can stack up your wonderful innovation projects to matter in terms of the health of our population and the health of our planet. Well, so the latest academy that we will launch this year at CHI INNOVATE 2024 is our Sustainability Academy. And we have wonderful partners here. I would just like to call out a few of them. The Geneva Sustainability Center. Sonia, thank you very much for the support. As well as we have the Center for Sustainable Medicine. Thank you very much, Nick and your team, for being with us today. As well as a whole host of academic partners. We even have a pharmaceutical as well as a payer working very closely with us to influence our ecosystem in order that we together can support a sustainable healthcare for our common future. So I'll leave you with a phrase that as a health system, we don't just want to care for this generation. We would like to care for generations to come. And together, that is possible with everyone in this room. And I look forward to a very engaging conference today. So I'll hand you back to our lovely host, team, and Tamsin.
Thank you very much, Eugene. Now let's get back to why we're here today. We have to begin at a time when the Earth was in equilibrium. The trees, the oceans, and the land were putting out carbon dioxide into the air, but they were also taking it back completely almost. But with the industrial age, mankind came along, and we put a lot of CO2 into the air without taking it back, alongside many other gases. So these gases accumulated in the atmosphere, and we call them greenhouse gases.
As a result, global temperatures are now rising like never before. You can see we've already experienced the hottest January, February, March, April, May, and June in history. And with higher temperatures, the ice caps are melting faster than predicted, and sea levels are rising rapidly. In the next visual, you'll see what could happen to Singapore. The areas that will be underwater in the future. And we can see on the following video what Gardens by the Bay and Marina Bay Sands will look like in 2045 if we don't take urgent and collective action.
But ladies and gentlemen, I think we all know that the healthcare crisis and the climate crisis are interlinked. The climate crisis is also a healthcare crisis, and this will be the biggest challenge that we've all ever faced. Our services, as we all know, are already under strain now, but global warming is going to bring a new tsunami of patients to our doorstep, with heat disorders, infectious diseases, respiratory ailments, infections, epidemics, and more.
And as we're aware, it will be the poor and the elderly in our society who will bear the brunt of all of this. In fact, 135 million premature deaths have already been linked to air pollution and climate change since 1980.
So, man-made activities, including our activities in healthcare, cause global warming, and that leads to a massive healthcare burden. We are responsible. As a sector, we actually produce 2 billion tons of carbon dioxide equivalent annually, which is at least 4.6%, if not more, of global emissions. If we were a country, we would be the 5th worst polluting nation on Earth. We actually emit more carbon than aviation and shipping combined. Our biggest sources of carbon emission in healthcare can be seen here. The hotspots are anesthetic gases, waste from OT, ICU, and endoscopy, asthma inhalants, and many more.
So this crucial data is coming from the UK and Singapore, some leading experts, and that you'll be hearing from them over the next 2 days, including Nick Watts, Sonia Roshik, and Eugene Liu.
Now, in healthcare, we've always upheld the principle to do no harm to our patients, but the very act of healthcare actually harms the environment. So can we do better? Can we deliver the same, if not better, healthcare without emitting so much carbon dioxide?
Will future generations of patients and healthcare providers look back at us and regard us as good ancestors, or will they suffer the consequences of our inaction?
So that's why we're here today at CHI Innovate 2024. We're exploring the relationship between us and our environment and how we affect each other. And we're looking for solutions that are innovative, that will inspire and galvanize all of us to be good ancestors for future generations. So
yes, let's let you know what you're in for over the next few days. The conference will take you through 4 chapters through the 2 days. In the first part today, we'll understand how climate will affect health and healthcare. We'll have experts delve into the global landscape and how this is affecting us all. In the second part of the program, we'll then try to understand how healthcare is contributing to the climate crisis. What are the challenges and constraints we face as we try to make healthcare greener? And how is leadership trying to address this through different lenses?
But thankfully, it's not all doom and gloom. In the third part, we're going to throw the spotlight on what has already been done, all the good work that's already been done in healthcare and other sectors. We're going to go for some site visits as well. There'll be a center stage from our government CSO, and some of the green champions amongst us will be speaking at a panel.
So, I think we're about ready for the next part of the program. But please note, at CHI Innovate, we aim to practice what we preach, and we hope that you will follow our lead as well, or maybe role model more sustainable practice to us. Throughout the 2 days, you will see nudges and tips and advice to encourage you to take the more sustainable step. So we hope that you'll join us in that, and we'll share more about that later on. But to kick off the conference this year, we would like to cordially invite Minister Fu to deliver her opening address for CHI Innovate as our guest of honor. Thank you.
Minister Fu.
Good morning. Mr. Joe Sim, Group CEO, National Healthcare Group, Mr. Eugene Fidelis So, Executive Director, Center for Healthcare Innovation, distinguished guests, ladies and gentlemen. A very good morning to all of you, and I'm so delighted to be here. And really nice to see so many of us here believing in sustainable development, believing in sustainable healthcare, and really applying our minds and our innovation and our ideas to doing one of the greatest challenges that mankind has to deal with now. And actually, as I was walking through the exhibition today, and I'm very struck by the energy, the ideas, the innovation. So thank you very much for really putting your heart and soul into this matter that's so urgent, and I really urge you to continue with it, because we are only at the starting point. There's so much that we can do together, and I'm sure just by bringing the ideas together, learning from one another, we can all bring back, and make improvements in our own area of work. And the other thing that really struck me was this little red dot here that says Qi. For me, I just had Qi in my mind. Qi in Chinese actually means breath, it means air. But actually, if you think about sort of the traditional Chinese healthcare, Qi is the energy that goes around your body. And the Chinese medicine will believe that if your Qi is not in balance, the yin and yang is not in balance, it will show up in different symptoms in your health. And ladies and gentlemen, the Qi of planet is really out of sync. As we have seen in the video earlier on, we are producing too much greenhouse gases that is entrapping the planet, and it's actually increasing the temperature. And the Qi, it's in some places, it's just too hot, as we have seen in extreme temperatures now being recorded in India, in Italy. And we have seen Qi resulting in very, very dry atmosphere in some places, drought. As a result, we see forest fires in Los Angeles, for example. Qi is also out of sync in places where temperature is so high, water is so scarce, that food production is actually being affected. So we have volatility in food production, in food yield, and that's resulting in food price volatility, and that's impacting people's life, cost of living, in a very direct way. Just to share a fact, last year there was a drop in production of rice in India, and Indian government basically put an export ban. We take very little Indian rice. We don't need a lot of that because we mainly consume sort of the Thai, Vietnamese jasmine rice. But just because of that one move, the quantity that's available in the market, global market, dropped, and all the prices went up, including the jasmine rice that wasn't affected by the ban. So price volatility is really in becoming one of the major political issues. And if you look at how politics have been demonstrated around the world, cost of living is top of line for many, many people, voters, and politicians. And why? Actually, the Qi has a lot to do with it. Has to do with the issues that we are dealing with. And of course, because of global warming, we are seeing new types of diseases as well. I think in the video we've seen earlier on, some of my colleagues from Northern Europe just told me yesterday that the mosquitoes there are getting bigger. I don't think that that's true, but it means that probably a lot more mosquito population is increasing. And it is only a matter of time that they will get a lot more of the diseases that we are used to here, being in the tropics, in that temperature and the humidity that we know of. It's going to show up in places that have never seen before, never been a problem, major problem for them, but increasingly they have to deal with it. And of course, I think the Qi problem is also going to help us when temperature gets warmer. What is the impact on chronic illnesses, patients with chronic illnesses? How do you deal with elderly that is aging and having to deal with hotter temperature? All these are interrelated, so that's why the Qi problem is an important one, because it's never just one issue, but there is one single cause, and that's really climate change. and that's really greenhouse gas. It's that one temperature that is causing it, but the causes of that temperature rise is all of us here. All of us here in our daily lives. It's not just the healthcare sector, but it's also how we live, how we work, how we move, mobility, how we use that, and that how we consume, how we throw away our things, how we use single-use products, how we use, old linens. It's you and I that's making the decision each day that has an impact on the chi system. So I'm very glad to see that, the healthcare sector, CHIs particularly, taking upon sustainability as a main theme for this year's event, and really focusing on this very important issue that impacts all of us and is also caused by all of us. Okay, I think I've dealt with like 5 pages of my speech, which I will not want to repeat. I wanted to say that, it is also a time where we see attention because the change is so drastic, particularly in the last few years, that none of us can deny that there's global warming. None of us, because every country, every continent, every season, we are seeing different climates impacting us. We are feeling the change in climate. I think it's really, so apparent to every one of us. And all sectors are on board, I think, and I'm just very glad to see the healthcare sector coming on board as well. So last year was the first year that we have, representation, COP28, they were the first ever health day at the UNFCCC. UNFCCC basically is a UN organization that's been tasked to look at climate change at the global level. And every year we have a conference of party, COP. And this is the first time in last year when we had the active participation of WHO in one of the days where we focused really on climate mitigation and adaptation for the healthcare sector. So global leaders are acknowledging this, and I think it's really timely for us to apply our minds to this very pressing issue. As we have heard earlier on, we, healthcare, is both a cause as well as a victim. It's a cause because of the consumables that we use, the way that we consume utilities, the way that we consume, our resources, the way that we dispose our waste. We are causing climate change, but at the same time, we are also at the receiving end. So we need to, think about how we can both mitigate the imprint of the sector on global warming, as well as prepare. This is the position that the Singapore government takes. We want to mitigate as quickly, as much as we can. We have set very ambitious target of net zero in 2050, given even with our very limited options on renewable, we think that we must set ambitious target and to lead the entire country, both in policy making as well as in investing in renewable energy, investing in R&D, in innovation to finance the technologies. So in this process over the next 3 decades, a lot is going to change. We basically got to decarbonize, take up fossil from 100 years of embedding into our daily lives to find an alternative to fossil. So while we are doing that, we are also not taking chances. We are also preparing for potential warmer days. And so there's also investments in adaptation. Adaptation is not just in coastal protection against sea level rise. We're also looking at how do we deal with water security. We know that we are importing water, but what if there's large-scale dry season, drought in this region? Where do we get our water? So these are all issues that we are planning through. We are building capacity in desalination. We are looking at not renewable, but new water that's recycled. So these are all sort of steps that we are taking to ensure that there's water resiliency in our system. We are thinking about the same thing with food as well. While we import 90% of our food, there's never enough land for us to grow whatever we need. But we need to think about, systemic causes. If this qi is out of whack in this region and it affects production of rice, vegetables, fish, seafood, proteins that we consume, what would be the alternative? So we're looking at investing in capability that's climate resilient in food production, particularly, specifically for Asian diet. And that's also something that I think is interesting for healthcare as well, because it's not just about producing, food that is consumed in the northern hemisphere, but it's really to find production technology, nutrition that is required for Asian bodies. So that's something that is ongoing in our National Adaptation Plan as well. So here, I would very, very happy to be here, to be really speaking to you and sharing with you some of the achievements that your fraternity have done. So I have the opportunity to learn some of your efforts that is being carried out in NHG, in NUHS, and Sing Health. And I've seen, reducing waste, upcycling, energy efficiency, eco-friendly technologies, all this add up. And I was just sharing that there's so many things that you can do. Many of them actually has impact. The use of cooling, electricity in cooling, if you're able to moderate that energy that's needed to cool your OTs, the number is fantastic. We're talking about a few gigawatts a year. And you know what's that gigawatts number in terms of scale? In Singapore, we talked about importing renewable energy from our neighbors. We have a few contracts that's already out there to import from Cambodia, Laos, Malaysia, Indonesia. We are talking about 5 gigawatts. And if you can reduce from 24 hours cooling if you're OT down to a certain hours, I can't remember specifically, but I think if you cut short it so that it doesn't waste all the cooling, you are giving us that whole contract that we are importing. Just think about that. So if all of us, collectively, all sectors are able to do that, reduce energy, increase energy efficiency, then we need to import less. Then we need less to change the mix from fossil to renewable sources. If the pie is growing, and then we have to convert the entire pie from brown to green, it's a lot of hard work. We're going to be reliant on our neighbors for a long, long time. But if we are able to reduce the pie, shrink the pie, then I think it makes us, make our task easier when we talked about adjusting the mix. So energy efficiency, reducing waste, great stuff. So I would like to congratulate NHG's Tan Tock Seng Hospital and Yishun Community Hospital for achieving an important milestone. They are amongst the first public hospital to be awarded the BCA Green Mark Platinum Super Low Energy Rating. And this is really a difficult thing to do. I know that ministry is going through a process of designing our own building as well. So I know that it really takes a lot of, innovation, groundbreaking decision, and it's a prestigious accolade and recognizes the hospital's commitment to environmental sustainability. Operating over 2,000 beds, covering more than 60 clinical disciplines, TTSH has been able to control its carbon footprint through statewide adoption of sustainable practices. For example, TTSH I department collaborated with the Singapore Institute of Technology, an overseas NGO called Rethink Good, as well as local social enterprise Samula, to reduce waste that's produced during cataract surgery. So I think there is also an art installation. I know that the doctors and nurses are extremely talented people, but I didn't know that you can do art installation as well. So if you have missed it, please take a look at the art installation that has been put together, just showing as a demonstration the amount of waste that is being generated in a typical cataract surgery. The amount that is disposed and the amount that's recycled. And if we are able to, really give the recyclables a second life or even upcycle it, and that's how we can reduce degradation to our physical environment. Because every item that is being used and disposed of, it leaves a mark on Earth, either as a resource that we have to mine, or it is really in producing CO2, because anything that requires production has energy in it, has water in it, is actually using up resources. So just remember this, the Qi actually needs all of you to restore. And when we looked at, all this horrifying photo of mines that left, huge craters on Earth, think about where does it go to. And next time when you pick up an item, whether it's a medical supply, whether it is medical equipment, think about what has gone into that. Could I be the one that is leaving that mark in that big crater somewhere else across the world? And if the answer is possible, possibly, yeah, maybe it's my supplier, but actually it is us that's using it, right? So we need to draw the link, and we need to understand that every one of our decision here has that. So, just looking at how the cataract team found ways to upcycle non-biohazardous waste, I think this is really to try to reduce our mankind's imprint on planet Earth. So 2,400 cataract surgeries undertaken by the team with 7,240 kilograms, 7 tons. 7 tons of waste generated annually. This is really, if you are able to reduce that, it's really a great potential for us to reduce footprint, because waste generation, collection, disposal require resources. And in Singapore, at the end of the waste treatment process, which is really incineration, ash, we need to find a place to place it, right? So we need to dedicate a space, precious land in Singapore for waste storage. So anything that can help us reduce that, it's really a sustainable practice. MOHH, holding company of Singapore's public health institution, is also setting a positive example by integrating sustainability into healthcare infrastructure projects, aligning with the National Green Gov.sg. So under MOHH's Green Frontier Framework, it has been integrating best practices for sustainability into healthcare infrastructure projects that include Kallang Polyclinic and long-term care, Kaki Bukit Polyclinic and nursing home, and the upcoming Woodlands Healthcare. We are investing so much into healthcare infrastructure. Every single one of them is an opportunity to push the boundary better, to allow new technologies, new green products to be incorporated in the production. Every one that is introduced is a new product that have the potential to scale. And this is really what we need to do, is to change the market so that products that's sustainable, that's green, maybe a little bit higher cost now, but if there's enough scale, we will drive down the cost and we'll make it more affordable, then it will become mainstream. So the government is doing that with GreenGov. You'll hear a little bit more from my Chief Sustainability Officer later on about how we are using government procurement really as a means to resource the market. We know that it's going to be a little bit higher because it just doesn't have the same scale, right? So green products will need us to intervene, and there's no better place to intervene here because you are really going to invest a lot on infrastructure over the next few years. So how you build, how you design, so that the design itself allow for more sustainable healthcare practices, I think will go a long way to help us make that shift in decarbonization. On this note, I'm really happy to announce the launch of the CHI Sustainability Academy. In collaborating with outstanding organizations in sustainability, including the Center for Sustainable Healthcare, Geneva Sustainability Center, Merck Sharp and Dome, NANRISE, NTU Energy Research Institute, NUS Center for Sustainable Medicine, Singapore Institute of Technology, SingLife, the CHI Sustainability Academy aims to build capability, culture, governance, and thought leadership to enhance the resilience and reliability of healthcare systems and environment. The Academy will also act as a hub to empower individuals and teams to become effective activators, collaborators, and agents of change, creating new knowledge and practices. I congratulate CHI on the launch of this academy. It is timely and well-placed to drive environmental sustainability in our healthcare sector. Today, we also want to recognize individuals and teams who have transformed groundbreaking ideas and innovations into reality. The National Health Innovation and Productivity HIP Medal embraces the value of sustainability and encourages ground-up innovations that increase productivity and efficiency while reducing waste and costs. Reducing waste is always good for the environment. So good. This year, 10 medal winners have been recognized for their innovations in care redesign, automation, IT and robotics, workforce transformation, and adoption. And I hope that next year we have a new category in sustainability. Yeah? Awards as well as ceremony like this where we give out awards are always important because it's an occasion for us to first acknowledge the hard work of the recipients who have, despite demands, many demands for their time, dedicated their precious resources into something that they are passionate about and create something out of the ordinary. It's also for us, the rest of us, to learn and to be inspired by them. So I'm very glad that we have this award here. Really is to serve as a signal for the society, signal for the sector, and signal from the political leadership that this is an important thing for us, and we want to support, we want to commend, and we want to promote. So we hope that you'll continue to find new ways to scale up your innovation, and also to find greater ways for us to meet with our challenges such as climate change, challenges such as environment degradation, and challenges such as aging population. At CHI Innovate Conference 2024, this is a unique opportunity to innovate solutions to transform our healthcare sector into a model of sustainability. So let us learn from one another, share practices, and forge partnerships that not just protect our environment, but also safeguard the health of our patients and future generations. So this is a shared responsibility. I hope that I have, last few minutes, convinced you about the importance of putting the environment into your consideration. Remember, the Qi really is the one that is connecting all of us, and it's really the deciding element about the health of our patients, the health of a community, and the health of our planet. Thank you very much for listening.
Thank you, Minister, for a very inspiring and impassioned call to action for all of us there. So the time has now come. You've been given a little teaser about what's happening next. We are about to launch the CHI Sustainability Academy. But before we do so, sit back and enjoy a short video that explains why this is so important to us.
Enjoy the clip.
As we strive to add healthy years to the lives of Singaporeans, we recognize that the ongoing climate crisis is also a healthcare crisis. Climate change poses many challenges to the health of all individuals, including the rise of vector-borne, respiratory and heat-related illnesses. Increased hospital attendances and disruptions to critical supply chains will exacerbate the strain on our healthcare system.
So paradoxically, healthcare contributes directly to the climate crisis in direct violation with our oath to first do no harm. At a global level, if healthcare was a country, we would be the 5th largest emitter, higher than both shipping and aviation combined.
While Singapore's healthcare system is often lauded for our achievements, we were cited in the 2021 Healthcare Without Harm report as being a relatively high emission provider with over 1 ton of emissions per capita. Now, this revelation underscores the pressing need for reform of our system to contribute towards the collective global effort in achieving net zero emissions by 2045. As we abide by the mandate of doing no harm to our patients, We should also commit now to doing no harm to the environment. We must create a sustainable healthcare system that does not compromise resources for future generations. We need to be good ancestors.
The Center for Healthcare Innovation wants to drive innovation for systems change. And we see change happening at 3 levels. At the care level, we would like to deliver better value for our patients. At the system level, we want to be able to deliver health for our population. And at the ecosystem level, we want to look to the sustainability of our health system. As we look towards the health of our population, we will also need to look towards the health of our planet. Because not only do we want to deliver health for this generation, we would like to deliver health for generations to come.
Surveys indicate a strong desire for a more sustainable healthcare in Singapore, but there are currently little know-hows, dedicated resources and capability to make necessary changes.
So our academy will seek to address this gap through a translational, knowledge into practice approach that builds capability, culture and thought leadership to enhance the resilience and reliability of our healthcare system and our environment. In collaboration with leading organizations in sustainability, our academy will bring together international and local perspectives on strengthening sustainability capabilities within healthcare. With programs co-developed and co-delivered by our esteemed partners and faculty, along with our panel of expert coaches to provide longitudinal coaching for project teams, the CHI Sustainability Academy will empower leaders and professionals in 4 main areas of capability building, as shown by our CLIMB model. Firstly, we will seek to drive care model and service redesign to effect quality and sustainable change. Professionals are trained to drive sustainable change by applying principles of quality improvement, lean and design thinking. With that, we will not only bring about improved clinical care, but also care that is less harmful to the environment, with less social impact on our patients and with less financial cost as well.
Secondly, we aim to engage leaders to build much more sustainable organizations, and we plan to do that by deepening their understanding and broadening their understanding of concepts so that we know what sustainable healthcare is all about and can accelerate progress.
Thirdly, we want to help project teams to quantify the sustainability impact of their solution so that they can better optimize it and communicate it clearly and effectively to their stakeholders using metrics such as carbon footprint and material usage.
And last of all, we aspire to help project teams deploy sustainable materials and environment in healthcare by helping healthcare professionals gain settings-based insights and opportunities when introducing sustainability. Through CLIMB, we envision a future with leaders and professionals alike empowered to be activators, collaborators, and agents of transformation, innovating towards a greener healthcare system. Our efforts to do so would be futile without collective action, so we would like to invite all of you to join us in this critical mission.
Great. Thank you very much. And very soon, from this month onwards, this academy is going to be calling for project teams with problem statements to come and join our program. So I know there are many, many people here with problem statements and sustainability. Please join us on that journey. We hope to equip you with not just the skills, but the agency to make change and transformation back in your hometown. I've been so inspired, I think, Tamsin, by meeting so many of you who are like-minded and passionate as well. There are so many ground-up groups and also some chat groups on WhatsApp. So hello to all my friends in Green Dogs and Amanda Zane, who's the leader, the gang leader. It's been inspiring to meet all of you. But we've got so much work to do now. How to bring these green ideas to life through this academy.
Yes, and so to do so, may we start by inviting our Sustainability Academy partners up onto the stage, please, so we can get the launch underway.
Let's welcome them on stage.
Can we invite you to gather around the globe? Stand around the globe, please. We need you to surround the globe. And if I can perhaps ask you to hover your hands above it. This is real orchestration, right? Hover, hover, hover. Don't touch the globe yet because I'm going to use the power of your hands. No one follows my instructions, right? Okay, ready. On the count, when we count down, we will touch the globe and bring it to life. Are we ready? 3, 2, 1. Yes, we got there. Brilliant.
All right. Our partners, ladies and gentlemen, thank you very much. And now you can move over to the side, please, towards
Join
me.
us over
on the
here.
side.
Thank you very much.
That's right. So it takes a community and it takes teachers as well. So let's bring on the faculty and our coaches. Can we bring our faculty and coaches? There they are, to this side of the stage.
Again, please gather around the globe. Don't be shy. Hold your hands above it.
Hello.
Thank you.
Hi, man. All right. You've seen those guys do it. You can do it better. On the count of 3, 2, 1, please touch the ball. Partners, our faculty, our coaches. 3, 2, 1. Ladies and gentlemen, our teachers, thank you very much. Can we move over there, please?
Thank you. And last but by no means least, may we invite our distinguished guests to join us on stage, again behind the globe, with Mr. Philip Ong, Deputy Secretary for Ministry of Health. Thank you. Jasmine Lau, Deputy Secretary for Policy for MOH. Thank you. Please gather around the globe. Thank you. We have Mr. Anthony Tan, Chief Executive Officer of MOHH. Professor Joe Sim, Group Chief Executive Officer of National Healthcare Group. Thank you. Professor Eugene Fidelis-So, Deputy Group Chief Executive and Executive Director of CHI. We have Associate Professor Dan Yok Young, CEO of inṋovateFong Hospital. We have Associate Professor Eun Ki Chong, CEO of CGH. We have Mr. Tan Tai Kiat, COO for Environmental Sustainability at Singapore Health Systems. We have Mr. Stephen Lowe, NHG Sustainability Committee. And we have Professor Nick Watts, Director of NUS Centre of Sustainable Medicine. And may I also invite Minister Grace Fu to join us on stage from the Ministry of Sustainability and the Environment. Thank you. Thank you all. Now, by now, you all know the routine, huh? No touching of the globe until the countdown.
All right.
Okay, perhaps. Thank you so much.
There's one more part of this equation, and that's the audience, all of you here. So we'd like you to help power up this globe by taking your handphones and switching on the lights. Can we see all that, please? We need to power up this globe with a bit of light energy.
Oh, now we all feel
more.
like...
It's not going to spin
through
through enough
Taylor
of you do
Swift
this.
now, right now, huh?
That's great. All of you, please. It's not going to spin until there are enough of you. All right, I think we're almost there.
I think that looks incredible.
That looks good.
Wow.
That looks good.
So
all right.
I think the globe is brimming with energy from all of you, so it is ready for the final countdown. May we please invite our distinguished guests to hold your hands above the globe, and we will get ready for the countdown. In 3, 2, 1, launch! Oh, well done, everyone.
Ladies and gentlemen, CHI Sustainability Academy is now officially launched. Thank you all. May we invite everyone to gather. Come forward for a group photo, please. All right. Come forward, everybody.
Come forward, everyone. We want your beautiful faces in the photo.
We can close up around the globe as well. Just come forward. Yes. Everybody here. Let's join them. Okay, there's no launch if there's no photo, so all right. All right, thank you very much. Thank you very much.
Thank you so much.
Back to your seats, please.
So with that, the CHI Sustainability Academy is launched. Thank you to all of our partners, our faculty, our coaches, and to our distinguished guests. Well done, you all managed to follow those complicated instructions well.
Right, let's move on to the other side. Let's move on to the next segment. All right. Here.
Minding the globe,
Yes.
which is on its journey to the side.
That's right. That was
here we
great.
go.
I think we can all go home now. Well, thanks to the team from CHI and our conference organizer. That was fantastic. All right, it's time for our next segment. And it's time to present, actually, the National Healthcare Productivity and Innovation Medals, the NHIP Awards. This prestigious national award for the 8th year running provides an opportunity for Singapore's healthcare and community care groups to showcase and celebrate all the excellent work that we've done in the past year. This year, we received a record-breaking 158 submissions from over 45 institutions, public, private, and community healthcare. This is the highest number of submissions that the CHI team have had to filter through since we started this national award in 2016.
It's quite incredible, huh?
It was a lot, but good work.
Well done. So this year's submissions were assessed by our 7 distinguished panel of judges that were chaired by Mr. Philip Ong, Deputy Secretary of Development from the Ministry of Health. On behalf of the organising committee, we'd like to extend our heartfelt thanks to all of the judges.
Similar to past years, the NHIP medals recognize teams who achieve excellence in 3 award categories: care redesign, automation, IT and robotics, and workforce transformation. We'll also be giving away our top award, the pinnacle award called the Excellence Champion Medal, that in yellow up there.
Yeah, and in addition, we're also recognising teams that adopted past national winning solutions. This is really about scaling and sustaining. This is with the Best Adopter Medal. It's to celebrate those who've learnt from others' successes, adapted them and implementing them in their own environment, so that they can really achieve these impacts and scale them on.
That's great. So all winners of the NHIP medals this year will be awarded, of course, with a medal, but also a cash prize and a seed grant of $50,000, courtesy of MOH, aimed at incentivizing those project teams to move on to their next innovation project. And as a whole, our 10 winning projects today have done a huge lot with huge impact. They have collectively contributed to cost savings of 8 million Singapore dollars this year, hospital bed day savings of 2,200 bed days per year, and time savings of 1,600 hours per year. A round of applause, please, for this result. We hope that these projects remain sustainable and lasting as well, and they've got the potential to be scaled well beyond their own institutions. So for details of these winning projects, do check them out at level 2. They've got a display and a showcase there during the break.
Thank you. So, without further ado, let's hear more about our winners and let them receive their awards. Minister, may I please invite you back on stage? Thank you. We're making you work very hard this morning. Thank you. Let's call upon our first medal winners. These are in the Best Adopter Medal category, and we have 2 awardees. So first we have Singapore General Hospital. Please come on stage for their value-based introduction of exoskeletons for gait rehabilitation in physiotherapy. Adapting the 2022 HIP medal-winning solution iMove, their patients received such hybrid assistive limb training that showed greater functional recovery. Well done. Next up, we have the Best Adopter Medal to St Andrew's Community Hospital. Please come on stage, thank you. This is for their implementing value-based care in the hospital project. You've got your fans in the crowd, well done. This was a project that learned from the value-driven outcome project of previous years. It led to an improvement in quality of care of hip fracture patients by 26%.
Fantastic.
Well done.
Next, we're giving out the best practice medals, starting with the care redesign category. We now like to call on our 3 winning teams for this category in order of merit. Our first medal in this category goes to SGH and NNI for their project reducing door to puncture time for EVT in stroke. This team has streamlined the decision processes and reduced the intervention waiting time by 37% and shortened the referral process from CGH and SGH by 42%. Well done.
Congratulations. The next Best Practice Medal for Care Redesign goes to Tan Tot Seng Hospital for their Advanced Practice Physiotherapist and TTSH Emergency Department. Oh, I think there's a few fans in the crowd for you there, huh? This care model has significantly reduced patient wait times by a whopping 75% and throughput time by 28%. Congratulations.
The third Best Practice Medal in this category goes to the National Heart Centre of Singapore for their project preventing kinking of distal perfusion catheter for ECMO circuit. The new DPC, or distal perfusion catheter organizer, developed by this team has eliminated kinking incidents from 60 cases to 0. This has resulted in savings of 410 man-hours per year.
Congratulations. We would next like to call upon the winners of the Best Practice Medals under Automation, IT and Robotics Innovation. First up, we have the team from inṋovatE General Hospital for their automated code red alerts and ICU outreach nursing service. Congratulations, the automation helped to triage and reduce only 8% of alerted patients required admission to ICU, forming a safety net of efficient and effective care. Congratulations to the team.
The second team who's going to walk away with the Best Practice Medal in this category is from National University Hospital, leveraging Endeavour AI to eliminate redundant CT studies. This platform has led to a 90% reduction in vetting time required and a manpower cost savings of $35,000 and a machine cost avoidance of $132,000 per year. Congratulations, INNOVATE.
Congratulations.
Yeah.
Next up, we'd like to call upon the winners of the Best Practice Medal under the Workforce Transformation category. Can we please invite the team, another team from inṋovatE General Hospital onto the stage for their vertical integration of hardware and software automation in pharmacy. Through upskilling in the digital literacy, the team revamped their pharmacy automation capabilities, resulting in a, wait for it, 92% reduction in drug dispensing idle time. Congratulations.
The next winning team for this Best Practice Medal for Workforce Transformation is from Bright Hill Evergreen Home, with their project called Escape, empowering senior care aides to prospects in education. This project has led to a manpower savings of $324,000 per year and a reduction of nurses' attrition rate by 10%. Well done, Bright Hill Evergreen.
Congratulations. Last but definitely not least, it's our honour to call upon Alexandra Hospital to receive this year's Excellence Champion Medal for their project Palliative Response Team, increasing the success rate for compassionate discharges. 77% of Singaporeans desire to die at home. However, only 27% of deaths do so. This project has helped to reduce a terminally ill patient's stay in hospital by an average of 3.5 days, allowing them to spend more time at home before they pass on, in an average of saving 2 days. From the hospital's perspective, this has allowed them to achieve a bed cost avoidance of $2.5 million per year. Congratulations to the team.
Alexandra Hospital. Everybody. Thank you. Could we get all the awardees to move forward and take a picture with Minister Fu, please? There you go, ladies and gentlemen, the class of 2024 for the INNOVATE medals. Please give them a round of applause. Thank you, Minister, and everyone else on stage. Please return to your seats.
Congratulations, well done.
Yes. Congratulations. Congratulations, all of you. Can we have a round of applause for our guest of honor, Minister Fu? Thank you. And Minister, I believe you've got to take your leave now, yes, right. Please remain seated as Minister Fu takes the leave. All right. Let's get on with the conference. Let's open that first chapter that we told you about, in which we'll try to understand how the climate crisis affects health and healthcare. It's my honor to introduce our conference's first center stage speaker of the day, Ms. Sonia Roshnik, who's the Executive Director of the Geneva Sustainability Center. In her leadership role, Sonia has mentored, guided, and inspired healthcare leaders throughout the world to embark fearlessly on their own sustainability journey. And today, Sonia is going to speak about accelerating action for sustainable healthcare. Please welcome Ms. Sonia Roshnik.
Thank you so much. It's wonderful to be here. And can I congratulate you on the launch of CHI? I love the Minister's talk of CHI and how we get that balance right in every one of us. Whether you're allowed to do that fiercely with CHI, I'm not so sure, but let's try. So I'd also like to congratulate all the award winners that we've just seen. It was wonderful to see the amount of quantification that was in there. So next year, the challenge is to make sure that all these awards quantify the environmental impact of these things in the same degree of sort of precision and consistency. So thank you very much for that. So I'm here to talk to you about how we can accelerate action. And in a way, I'm assuming that we're all already convinced that we need to act now and that we're already, buying time for ourselves. We've seen this, why we need to be doing this, but I'm really proud to say that the Geneva Sustainability Center is part of the International Hospital Federation. We're delighted that the Hospital of Singapore's network is a core member of the International Hospital Federation. And because the hospitals around the world feel that climate change is impacting so much on healthcare, it has been part of their statement to make sure that every decision in healthcare, wherever you're at, whatever it is that you're contemplating in healthcare, be that you're making a decision with a patient, whether you're buying a product, whether you're working towards better community and population health, every one of those things will matter to the future and more sustainable healthcare delivery. And we are only at the very, very beginning of this journey. We've got a long, long way to go. And that's part of why I'm saying that quantification is important, because we'll need to understand what works and what doesn't work in this space. So please join me in supporting this IHF statement, which says that we are going to make this integral to every aspect of healthcare wherever we are. That's part of what we're here for. We've heard about the fact that this is not just a climate crisis, it's very, very much a health crisis. And, when we're looking at healthcare, we've heard the Minister earlier, it's not just looking at how do we do more sustainable healthcare for today, and how do we design that into what we're doing, but also how do we prepare for the vulnerabilities of the future. It is absolutely imperative that we include our thinking and integrate those aspects together. So we've heard also that healthcare is part of a sector that is huge in this world. And we're not considered as a health sector in the same way as agriculture, or transport sectors. But I would like to challenge you all to make sure that as a sector, we are held to account on how we contribute to the problem and how we start driving these solutions. Because I very, very much believe that part of this CHI that the Minister was talking about lies within the way that we deliver healthcare on a daily basis. So Singapore, and I know some of you might not like this graph, because it doesn't show up as, if you look at it at a per person capita, we all hold a responsibility, not just within the work we do within healthcare, but within everything we do as individuals in our own lives. So this is very much a call to try and widen that so that you take it into account everywhere. And, we will be held to account on how we reduce that. Of course, some of the numbers behind this is very much to do with the energy sources and where they come from. So that transition to, lower carbon, more renewable energy really matters. And all of what we've heard already this morning around energy efficiency and not needing the contracts from overseas really helps contribute to that. So there's a real reason to be acting. So why is it that in Singapore that you need to be doing something about it? I'm not the right person to tell you, but I do know that, you know, you've got high per capita emissions, and also it will be a hotspot in time. And you've got high healthcare spending as part of your GDP. So it really matters. And what we do know is that if you don't do something about it, there's going to be a lot of money implied in what the impacts for healthcare, but also for Singapore as a whole. So this is your opportunity to really start making a difference. It does make business sense to do something about it. And healthcare leaders, we all are more trusted than quite a lot of other professionals in this space. So we need to use that voice to bring everybody else along with us on the journey. And, you know, I think one of my main messages to you will be that it makes business sense as well. So at the Geneva Sustainability Centre, we're trying to take quite a holistic view about what we mean by lower carbon, resilient and equitable care. And one of the messages is that if we're really looking to improve health for the future generations, and I'm a grandmother, I'm really keen to make sure that I leave a better world, a legacy for my granddaughter. You know, it is about integrating these different aspects. How can you improve quality of care whilst reducing environmental impact? How can we build resilience in everything we're doing? And, you know, we heard the minister talk about eco-design for hospitals, but there's also something about how we work with our communities to support them when there is a heat wave, how not to get dehydrated, how to make sure that they're looking after their own health in those times and what that looks like. It's very much a leadership role and a leadership competency. And I would like to challenge every one of you to find that chai inside you, that this is part of your leadership competency to get this right. It is also part of value of care. And I know whilst I've been here in Singapore, we've been trying to relate population health, you know, high value care, sustainability. They're all interrelated. We cannot look at outcomes for patients and populations without including in there an understanding of all the resources that we utilize, but also some of the fairness and equity that's inherent in the way we make decisions. So I would challenge us all to widen our concept of value of care and try and integrate these different elements. And so when we start seeing some of these awards, maybe we can include some of these numbers as well, just to start thinking in that way. So we cannot do this without getting the culture right. And some of that is around the policies, but it's never enough to just have the right policies. And, you know, we do need to challenge ourselves to put the right frameworks in place. But if you don't embed it in every single decision that's made, you're not going to get there. And you need to be able to engage with everybody around you to make that happen. It is part of a huge movement that we all need to take into account. And actually, at the end of the day, it's going to have to be so integrated into everything we do that it's part of a normalized process. Just like at the moment we cost everything, we will need to cost carbon into everything we're doing as well. And we'll need to be able to relate it to the health outcomes, because there's quite a lot of what we do in healthcare that's wasteful, not just in terms of physical waste, but in terms of time and other things that we utilize. So just talking about some other institutions that have worked in this space, the University Hospitals of Geneva have been on the journey for quite a while. They started with a mobility plan because for them, at that time, that was the most important thing, is how to enable people to get to the hospital without overcrowding the roads. Geneva wasn't built for lots of cars, so how could they really make that happen? And over time, they've really started building up what that looks like so that they've now got an action plan in place. And I would like to just say it is so important to make sure that you don't just commit to doing something, but actually to set some targets and to think about what that roadmap might look like. And Singapore's got a great opportunity to have a roadmap that includes the way you address population health in a sustainable way. So I look forward to seeing how you get on that journey. So in Geneva, they've also really focused in on what does this look like in terms of greener care, and they've appointed a sort of a CSO, a clinical CSO in their hospital. So they've got a chief sustainability officer, but they've got a champion at the clinical level who is their own CSO, and that is trying to really look at all the different aspects of healthcare. And they're trying to set targets around where they want to be. And I would suggest that these targets need to be quantified so that we actually know what those percentages might need to look like. But everybody's got to work on their own journey. I was asked also to do some reflections on what the NHS sustainability journey was. I was at the beginning of that. Nick, who's here, has been more recently on the journey. But I just thought I'd pick out some key lines. We were so lucky that there was a Climate Change Act in the UK in 2008. It set the tone. It meant that, it was the first country to do that. And what it meant for us was that somebody said, what does that mean for healthcare? Let's think about it. And we really did not know what to do with it. But we started on a first carbon footprint because we wanted to understand where the big things were. And just at that point, we did decide that it was important to include not just the energy that's used within the buildings and the energy that we buy, but actually to widen it to all the things that we influence in healthcare. And that is all the products that we utilize. And many of you will know that Scope 3 is one of the biggest areas, but that does not mean that it's just a buying process. It's the way we utilize products that is part of that, so we really need to integrate it. The first barrier, and you'll recognize this, I'm sure, was it's going to cost money. This is too difficult. So we had to find a way of speaking to the director of finance, and what we used was a marginal abatement cost curve at that time that just quantified every intervention in terms of its return on investment and the carbon saved. The vast majority of interventions have a good return on investment and save carbon. So, it is, and I'll talk a little bit more about the return on investment because we often think of it as going to be a big barrier, whereas actually you can start driving solutions. So just to sort of cut through, the Sustainable Development Unit became a greener NHS as a means of trying to embed this much more systematically into the NHS, and I'm so proud that we managed to change the logo green. That was not such an easy feat, believe me. So we then got to the net zero plan that was published, and now it is embedded in legislation thanks to a lot of the work that Nick has done. And one of the ways that that is translating is that there are some significant research grants now that are being put forward for people to talk and research what low carbon pathways of care are for healthcare and social care. So there's an integration understanding that you need to bring those two together. I really look forward to what those projects look like. So, going back to the return on investment, Kaiser Permanente, which I'm sure many of you know about, have really embarked on a journey and have really quantified what this means for them to start looking at things differently. But they are also interesting because they use a lot less bed days because of their approach of being both payer and provider. And through that, they can maximize the amount of money they put into prevention and supporting people to be healthy, and therefore minimize the number of bed days they need. Those are models that are really worth looking at way beyond the elements that are here. So, returns on investment, these are just some other examples just to try and prove to you that if you really want to look at it, you can cost everything. And we saw some of the projects earlier that had costings in it, but there is so much that can be done that will be a return on investment and be a return on carbon and improve care. So we've got win-win-win-wins. So I'd like to try and say to you, this should not be your barrier. It should absolutely not be your barrier. So what I'd like to say, though, is that this should be a leadership competency. If you integrate this as part of your journey as a leader, being a leader for the future, for future generations, for your grandchildren, your children, your grandchildren, you will be in the right place to start looking at this in the right way and know how to make decisions. I keep saying this, and I'm boring. This is not about a checklist. It's not about going tick, 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 have I done my bits? This is about embarking on a journey that's really about leadership. It's going to be transformational, not just for ourselves as individuals, as healthcare professionals, but for our organizations, for our countries, and for our planet. And I'd like to see healthcare leading it. So, what does the Geneva Sustainability Centre do? We do a lot of capacity building and strengthening, just like CHI does, and we're really proud to be partners on this journey with you. It's about raising the standard generally globally, and I'm also very pleased to say that, I think it was yesterday, but it was this week anyway, that the Joint Commission International launched the first time their hospital standards edition that has a chapter on environmental sustainability. This is the beginning of making this part and parcel of everything that everybody should do as a minimum, as a baseline everywhere. And we'll need to be driving the certification of that later. We've also got an accelerator tool that I'll tell you a little bit more about in a minute. So I was delighted that some of you will have been with me in a masterclass yesterday where we used this carbon emissions learning lab. It's a simulation tool to just try and say, okay, so if you really need to be in this space, what does it look like? Let's put you in charge of a 500-bedded hospital, and you've got a target to reduce carbon emissions by 50% within 5 or 7 years. We played it to 7 years yesterday, and everybody gets in the game very quickly. You don't question the target, you don't question the reason for doing it, and you've got to balance it with your budget, you've got to balance it with patient satisfaction and staff engagement. Guess what? Most teams got there, or got very close. I think most of the people in the room yesterday came away from that thinking, yeah, this is doable. I can go back and do this. So I hope others will want to try and that we keep demonstrating that this is possible. So there is also this accelerator tool, which I'm really delighted that the hospitals of Singapore are going to all contribute to through a maturity diagnostic so that you get a sense of where are the strengths and vulnerabilities across all of the hospitals and how you can then track progress over time on what you're doing. And then I've talked about these standards. So I just wanted to say a little bit about the fact that, yes, we as healthcare professionals, we've got a role. As hospital leaders, we've got a role. But there's also something about government and regulatory bodies who have got to help encourage a culture of sustainability. And there's something about if you've got the right framework and you're all agreed to be working to the same target, to the same measurement mechanisms, to the same approaches, we will all go there faster together. So I would like to, encourage you to encourage your government and your regulators to really get behind you to help you with the mechanisms that you need, the framework that you need to accelerate progress in this space. So I would really like to, I guess, somewhere along the line say, we are all part of this solution. We need to be part of this solution. And there are so many different ways that you can do that. And one of the things that came out of the masterclass yesterday, the feedback when people were using this carbon emissions learning lab, was let's go for the things that have the greatest impact and make the ones that are going to drive change for years to come. Do those immediately, so you can start somewhere. Think about the biggest impact, the things that are going to be really visible and demonstrable, and also, of course, do the things that you need to do so that people can understand that this is a culture change that's needed. Ultimately, I'd like this to be part of all of our CHIs, and I'm very grateful to the Minister for introducing that concept. So please, come on this journey, help accelerate action, start thinking about what this looks like, not just in your professional lives, in every decision you make everywhere, but also in every one of your personal decisions, because it matters. And just going back to government bodies, and given that I'm a grandma and that I'm representing Switzerland, it does matter because there are some Swiss grandmas who sued the Swiss government and won because the Swiss government did not protect them in their old age in relation to their health and the impending climate crisis. So these things we're going to see more and more. But these ladies said, we're suffering in our health because of climate change, and it's impacting on us, and the government has not done anything to protect us, nor has the healthcare sector, by the way. So there's plenty of responsibility on our laps to do something about it. So please lead by example, foster a culture, and make sure that you secure sustainable Singapore. And please, you've got the opportunity to show the rest of the world how to do this well. So get there and show us how you can do it. Thank you so much.
Wonderful. Sonia, thank you so much. That was fantastic. Could we ask you to take a seat, please?
Right. Thank you so much, Sonia. Inspiring as always. I'm sure that we've got lots of questions, and let's now invite our moderator, Dr. Jeannie Tay, who's our Tan Tock Seng Hospital Chief Sustainability Officer, to help you get through them. Jeannie.
Right. Okay. Thanks. Very good morning to all, and thank you so much, Sonia, for that very insightful presentation. I've heard Sonia for several times, and she's always so passionate about this cause. And we'll now open the floor for questions for the next segment. And just some brief instructions. If you have questions for Sonia, please submit them through Slido by using the QR code that's currently being projected. Alternatively, if you would like to ask your question in person, please raise your hand, and we will have runners send you a microphone. And when you're called to ask your question, please introduce yourself with your name as well as your affiliation. And without further ado, I'll start with the first question while we wait for the questions to come in. Sonia, thank you for that insightful presentation. And we know that there are countries that have had excellent outcomes and successes in their healthcare sustainability initiatives, and there have also been countries that have experienced failure as well. And in your opinion, what do you think are the ingredients or the contributing factors for these outcomes?
Well, that's a very good question. So I do think that one of the big differences about how you tackle sustainability in healthcare is whether you see this as a long-term journey, as a transformational program that you need to prepare for, organize, have a roadmap for, set up the governance structure, the metrics for, or whether you see it as a project. If you see it just as a project that's going to be a big thing and then it dies down after a year because the pizzazz has gone, then that's going to fail. You'll do a bit of a change, but actually this is going to have to be a transformational project that sustains the change and keeps improving and accelerating. So to me, one of the core things is understanding that this is a journey, and we're going to be on this journey for many, many, many years. So we need to build up a mechanism for making sure that we can not only retain the changes that we've made, but accelerate on them.
And it's about building a structure in place, right? In addition to the ground up, how do we set up a governance structure to sustain the movement on the ground as well?
That's right. You need the top down, you need the bottom up, and often we say you also need to incentivize the middle, because if you really want to make it happen.
Right. Okay, and I understand that this is your first time in Singapore as well. Welcome to Singapore. And you had also the experience, the opportunity to interact with our healthcare leaders and our healthcare professionals. And so, in your opinion, where do you think Singapore is in terms of our healthcare sustainability initiatives? Are there any learnings or best practices that we could take reference from other countries?
So I think what's wonderful in Singapore is that you've really got a will. Everybody wants to be working on this, and I've seen so many projects and really exciting initiatives. From visiting some wonderful farm on the top of a hospital roof with multi-layering of plants and solar panels, really good use of space, but also of how the plants actually thrive off each other. So there's also some fantastic, the minister mentioned it, around, the recycling of gowns. There's wonderful projects that are happening. I think for me, the big challenge I would suggest for Singapore is to start working collaboratively across the clusters and developing a roadmap for yourselves on what this is going to look like over time and how you keep driving that. And I've seen all the signs of that beginning to happen. We've had a great masterclass. You've had all the 3 clusters were in the room this morning, starting to think about, well, what would this need to look like? So you know, you're well on your way, and what I'd like to challenge you to is to overtake everybody else.
Yeah, we certainly want to do that. Okay, so the questions are coming in through Slido, and I think I want to ask this question, which you actually alluded to in your presentation as well, sustainability and cost, right? The question is, how can we balance cost investments with sustainability, given sustainable products are often not cheap?
Yeah, so the first thing to say is there's a lot of things that you can do for sustainability where less is more. We can try and be more thrifty and more careful in the way we utilize products and the way we utilize energy. And I think that's a really important starting point. Then, of course, there's some investment that might be needed in some aspects of what sustainability needs to do. And it's not always easy for a hospital to be able to find a way of doing that. Sometimes that can be through external sponsorship. It would be great if every institution and ministries actually put some upfront money into it. But the other way is to partner with a private sector. You know, you've got these energy services company who will upfront pay for the change in technology, the change in energy systems, and then both will reap the benefits and the cost savings over time. So there are some financial models to help with that. And I think it's only getting easier the more we're getting used to it and the more we're driving that further forward. Yeah. I would also like to say that I think with all the products we buy, we assume that by saying to our suppliers that we want things to be low carbon, that they're going to increase the prices. I think you should just say no. No future product or no product today that isn't low carbon should cost more, and it just should be part of the way that you become a supplier of the future.
Yeah, and I guess this is the role that the consumers will have, right? Is to demand that the suppliers be more responsible in the products that they produce. Well, I see another question here that I'm personally also very interested in. In medical care, the world has shifted towards a single-use disposable medical products to maintain hygiene. How do you go back to using reusable medical devices and maintain quality standards?
So I don't see the fact that reusable or single-use means that you get less quality care. I think we've been led down this thing where we feel that we've got to have single use for absolutely everything and then throw it away. We can design for reuse and we can reprocess to the same level of standards. It is just that we need to start demonstrating that that is just as safe and just as high quality. There are a few things that we're doing. I know certainly in the UK with Jakob Creutzfeldt's disease, we went very, very, very risk averse. And there's even single metal items that are not reprocessed or reused. We do need to also revisit our risk profiles around this. But I think we do not have to be led necessarily by the fact that a lot of the supply chain would love us to use as many single-use items as possible. We need to be starting to work towards what would a service like this look like. So, you know, with a laparoscope, they can be reprocessed several times and be rendered by the supplier to the same standards, safety standards as before. And I think it's that partnership we all need to be looking for, is how do we do this right?
Yeah, I think that's a very pertinent point to make. And even as I engage our healthcare workers in Tan Tock Seng hospitals, I do have people coming to me and say that, you know, we are using so much of the single use, how do we reduce that? And I think that requires really a multidisciplinary approach, working with our infection control experts to really look systematically at our processes and to decide, which would make better sense in terms of health and as well as the environment as well. Well, there is another question that has been receiving quite a significant number of votes. Well, we have always talked about digital technology, right, in trying to promote a greener environment. And this question pertains to whether, maybe if you could share your views on how AI, artificial intelligence, could promote sustainability. And will AI be adding more carbon emissions?
Well, so of course, any technology we utilize to try and help us on this journey will use more carbon or more energy if we're not careful. So we do need to do the balancing act across both of those and make those calculations. Having said that, I think most of you, certainly that are not my generation, will understand AI way better than me and what it could bring. I am hoping that it will help us source the information and the data that's required much more systematically so we can make decisions with that information in mind. But of course, every email you send has a carbon footprint, and we need to balance that out. We can't just throw technology at the problem. It's also going to require some thinking through about whether it's the right thing to do, and it will require us to really consider changing our behaviors.
Yeah, I think the digital age is upon us. We cannot evade it, but definitely we have to strike a balance as always. Okay, the next question that that maybe we should go into would be talking about consumers. Sometimes wastage comes from healthcare consumers who want to receive as much treatment as needed for their peace of mind. Is it worthwhile teaching the public to learn how to calculate their carbon footprint in healthcare consumption?
So that's really interesting. I was going to say we haven't involved a patient yet in this discussion this morning, and they're really central to it. We need to bring patients and the public along with us. I wouldn't necessarily say that that means that we need to teach every person in the public to calculate their carbon footprint and work out what's what. Yeah. I do think, though, they will trust healthcare systems to help them with those choices and to understand that. And I really admire those doctors out there that are already having those conversations with patients and saying, you know, there's this kind of inhaler you could use, which is really quite damaging to the environment, or you could use this one that's a lot better. Or maybe in certain cases, you might be, you know, I'm thinking of the fact that with mild anxiety, you're often better going for a walk than you are having some medication for it. And so I'm hoping that we can bring in a more holistic conversation about how to be healthier longer and how to do that in a more natural way. So maybe it's not about carbon footprint, maybe it's about a culture shift towards having a shared responsibility between health professionals and patients.
Yes, and you mentioned at the masterclass yesterday about green prescribing, right?
Yes.
Not just about prescribing treatments, but also how do you make the patient actually improve,
yes,
leveraging on the environment. I think in public health, we have utilized calorie labelings for patients to choose their food intake, right? And I think one idea could be that eventually we could have carbon labeling for all our treatment options so that patients can choose to decide, you know, if they want a more eco-friendlier options as well.
I agree. I mean, at the moment, we have staff that are, you know, in many companies, staff are choosing the companies they want to be recruited by based on their sustainability credentials. Well, I'm sure there'll be a day where patients will do the same. And I hope that day comes sooner for us all, because they will help move this faster.
Yes. All right, the next question is about the healthcare sector, right? The healthcare sector is a regulated environment. Do you have any tips to encourage policymakers to be more open or receptive and to act faster to propose changes to drive sustainability efforts?
So I don't know about you, but I always think that regulators or creditors or ministries are nervous that if they put something in place, they're going to have an abreaction from the field, from the providers of healthcare, from health professionals, from the public, either because they think it might cost more or because it will add to the workload or all sorts of other things. So I think it's incumbent on us working in healthcare to demonstrate that that's not necessarily the case, but that it can help us to have some guide rails about how we work towards that. And, you know, in places where they have put things in place, it really supports that change to happen faster. But, you know, we can give them the confidence to go ahead and do that.
Great. I think certainly it's important for us to engage the policymakers as well in conversation so that we can move together on this journey. Okay, the next question, I think, and we have time for one last question, and that is net zero really possible, or is it just an aspirational goal? Has there been any studies on energy required for daily living versus the capacity of renewable sources, and what are the other means, and how does the math add up to zero?
So it is really interesting, this net zero, because I always feel adding something up to get down to zero feels like the wrong kind of maths, because we're really trying to improve things and make things better, improve health, improve our planet. And so zero doesn't inspire in that way. Having said that, I think that certainly there's a different question between can the planet go net zero, which it must, and can healthcare do that? I think in healthcare we can get very close by really focusing our efforts on decarbonisation, thinking through how we focus on supporting health rather than sickness, and how we move in that direction. There will always be some residual elements that are very hard to abate, and we'll need to use a lot of innovation and research to get there. I'm hoping that by the time we've spent 10 years seriously decarbonising, that we'll start having really good ideas, and we'll have done some great research to help answer how we do that last bit. So I do believe it's possible, but that's also because I believe in hope as a big driver for making things happen. I also think that if we get there, it's not going to feel like zero. It's going to feel way better than that. So we need to find a way of helping people to do that. I do also think that it is like this question intends, it's way more than just a health system issue. It's a population-wide, it's a country-wide, it's a planet-wide thing.
All right, and on that very hopeful note, that will be our last questions. And thank you, audience, for your engaging questions, and also a special thanks to Sonia as well for sharing with us such valuable insights today. I'll close this session now. Thank you.
Thank you. Thank you, Jimmy, for being a champion too.
Thank you so much to both you, Sonia and Jeannie. Thank you.
Thank you.
So, it's time for us to deepen our understanding on how global warming will truly impact our health, our healthcare services, and even our home. So I would like to now invite a very fascinating panel onto the stage. And perhaps I can start with our moderator and four panelists. We have Miss Jasmine Lau, Deputy Secretary of Policy from MOH, as our moderator. Thank you, Jasmine. Please take a seat. She will be joined by Professor Benjamin Horton, Director of Earth Observatory, Singapore. Thank you. We have Dr. Sean Vasu, Clinical Director of NCID. Welcome. We have Mr. Chu Wen-tung, Group Director of Research and Development at URA. Thank you. And Associate Professor Jason Lee, Director of Heat Resilience and Performance Center at NUS. Thank you so much. So over to you, Jasmine, and everyone. This is going to be a fascinating conversation.
Thank you very much, and good morning to everybody here today. Fantastic to see so many of you come here today to listen to the topic of climate change in healthcare. Fortunately, we don't have any Swiss grandmas yet. But who knows, maybe in a decade or so, we would have some coming to the Singapore government. Now, I'll be honest with all of you here today that as a policymaker in the Ministry of Health, climate change often isn't right, squarely in the front of our minds. My job involves looking at money, manpower, and regulation, and we're often thinking about tomorrow. Tomorrow, we don't have enough money. Tomorrow, we don't have enough healthcare professionals. Tomorrow, there are more things to regulate. And I think quite often we forget that climate change is in fact going to impact how much money we need in future, how much people we need in future, and definitely more things to regulate in future. So this was a very timely reminder for myself for sure, and I think for many of us here today, that we should not forget about climate change. We shouldn't put it just at the back of our heads as something maybe we should do, as a mother, as a daughter, in our daily lives, but it's really something that we need to bring into the workplace. And each of us here in healthcare has a role to play. Now, we have an exciting panel lined up today for us to learn from. My role here is to help you get as much value and insights out from the experts. The experts do not include me, so keep the questions for them. Each of them will give you a brief presentation first, and then at the end of it, we will have a Q&A session. Now, there's a QR code on the screen. So as you listen to the presentations, please feel free to put in your questions, and then we'll have an exciting conversation later. So first up, we have Ben. Ben will inspire all of us to take action from today onwards. So Ben, take it away, please.
Okay, good morning, everyone. It's great to see so many people in the audience regarding an aspect to do with climate. The title in front of you is the climate emergency. So obviously, being in the healthcare sector, you know exactly what the emergency means. It means an event that requires urgent action. And that's where we are in climate. I'm a climate scientist. I've been doing this topic for 25 years. I'm the only representative in Singapore that appeared on the IPCC, the Intergovernmental Panel on Climate Change, to give you some indication of my credentials. And we are in a climate emergency. This graph, I'm going to show you a series of graphics to illustrate the dire situation we are in with climate change. So on this graphic, it shows daily temperatures in a calendar year running through from January through to December. In the grey lines are every line that has had a daily temperature since all of you were born in the audience. In the yellow line is the temperatures in 2023, and in the red is the temperatures in 2024. And you can see from June of last year, we broke records every single day. Every single day. If we look into our oceans are in a catastrophic state. It was announced this morning through a recent survey that 75% of the corals on planet Earth have bleached. 75% are dead right now. Why is that? In the grey bars, these are ocean temperatures running through every single day from January through to December. In the grey lines are the ocean temperatures that you've all been alive for. In the red line is 2023, and in the darker red line is 2024. Beginning in May of last year, every single day was the warmest ocean temperatures since records began. And in 2024, we are just off the charts. If you know something about statistics, in ocean temperatures, we're 8 standard deviations beyond the mean. Now, climate change is complex, okay? But some parts are incredibly simple. In 2023, we produced more carbon dioxide than we ever have done. In 2023, we had the warmest day. In 2023, we had the warmest month. In 2023, we think we had the warmest year for 120,000 years. Well, if you increase atmosphere and ocean temperatures, what happens to sea level rise? Well, sea level rise just goes up. We've got 2 colossal ice sheets on our planet in Greenland and Antarctica. Greenland and Antarctica, to give you a scale of the problem, the amount of ice that's held within Greenland and Antarctica has the potential to raise global sea levels 65 meters. 65 meters. What about Singapore? We always want to think about our local environment. So this graphic shows the cumulative increase in carbon dioxide since the 1930s. It shows the global temperature change, and then it shows Singapore's temperature change. Singapore is marrying the general trend of global temperatures, but if you look at the scaling on the y-axis, it's double the global average. Double the global average is what happens to all cities on our planet, because in addition to the greenhouse gas problem, urban areas have what's called the urban heat island effect. In my sort of undergraduate thesis, I'm from Manchester. I studied Manchester's urban heat island problem. So what happens with urban areas is that as Singapore is urbanized, it's removed its green vegetation, it's closed over its waterways, it has high density populations, no natural airflow, and we have materials in concrete and asphalt that absorb heat and then re-emit it later in the day. What is the impact on this? Well, this is an urban heat island for Singapore. So this is a map of the heat in Singapore on May the 12th last year. So May the 12th, 2023 was the warmest day any of you have ever experienced in Singapore. It broke records, but the distribution was very different. If you were in areas of natural vegetation, let's say around McRitchie Reservoir, and compare it to Bedok, there was around a 4 to 6 degrees C centigrade variability. So when we look into Singapore in the future, yes, we need to decarbonize, but we also need to modify how we build our cities. If we look into the future, I mean, this is absolutely horrific. So Singapore has invested greatly in climate science. It has what it's called the V3 climate model, which is the only climate model in the world which has been downscaled to a city-state. So when you think about climate change, Singapore's so small, global climate models won't provide any information, neither will regional ones. So you need a local model. So this is coming out of NEA. So if we look at the bar charts on very hot days, when we get above 35.1 degrees C in Singapore, because of its humidity, it's outside the adaptation limits for us. When it's above that, if you're outside and you can't cool and you can't hydrate, you end up in an emergency room, or even worse. So historically, between 1984 and 2022, before our temperatures started to really ramp up, the number of days per year were 5 to 10 days per year. Under a low emission future where we balance carbon, it's 120 days. Under a high emission in the red bar, it's every single day of the year. Think about that. Every single day of the year when you live in Singapore is outside the adaptation limits of humans. Sea level rise, that's what I study. I'm the only person in Singapore who's been to both poles, Greenland and Antarctica. This is an image, a surface image of the Greenland ice sheet under different forcing of temperature. Okay, so on the left-hand side we have temperature equals 0, so that's pre-industrial, what our temperatures were in 1850. Temperatures 1 degree Kelvin or 1 degree Celsius is around the 1980s. 1.5 degrees C was in 2023. If you get above 2 degrees C, which is predicted for the middle of this century, if we don't do anything about emissions, the Greenland ice sheet has gone. It disappears. It disappears. What's the impact in Singapore? Okay, that's your impact in Singapore. And there's nothing you can do about it. You can build the Long Island. Oh, great. But you can't protect the whole of Singapore and you can't protect the whole of Southeast Asia. That's my slide deck, and that's why it's an emergency, everybody. It's an emergency on temperature and sea level. I'm a climate scientist. I've been doing this for 25 years, and nobody listens. No, but they don't. Imagine being a doctor or a surgeon, and you have some disease. Well, let's think COVID, okay? And then you have a vaccine for it. Your patients listen to you. They take the vaccines as an individual, as a community, as a government. But on climate change, individuals haven't listened, communities haven't listened, and the government haven't listened. That's my fault. I haven't communicated it correctly. The fortunate thing, or the hope that we have, is that we still have time. We have about 9 years left to solve this. That's what the latest climate. We've already crossed this 1.5 degrees C threshold. You have 9 years. Tick tock, tick tock. Thank you.
Thank you, Benjamin.
Hi, my name is Sean Vasu. I'm the clinical director at NCID, and I'm an infectious disease physician by training. I think Ben has set the stage, and like he mentioned, there is a vaccine for COVID, but really no vaccine for climate change unless we put our collective efforts together. Some of the pangs that we've been experiencing, I think, coming out of COVID over the last 3 to 4 years, there is a definite interplay with emerging infections and pandemics and outbreaks with climate change. Sometimes the link is not as apparent, but I hope to show you in the next couple of slides what we are in for, what we have been through, and what we might expect. We did a review recently, Amanda Zane, Sapna Sadarangani, Lynette Sheck, myself, in the SMJ, and I will refer you to the article that's on the slide. But looking at climate change with a specific focus on Asia, half of known human diseases are caused by pathogens, which are known and projected to be worsened by climate change. The kind of interplay is multifactorial. There are host factors, there are vector-related factors for vector-borne diseases, and then the pathogens themselves. Zoonotic spillovers with human activity. I think looking at this market, I hope you wish you never would want to visit a market like this, but this is the truth that in our backyard in Asia, where if you look back over the last 20 years, where most of the emerging disease axes have come from, we are in a place, Asia, the most populous part of the world, and also where the next disease axis is most likely to emerge. Well, human behavior is driving it, but also climate change is going to increase, and scientists have done modeling studies where novel mammal-virus interactions are going to drive spillover events. So for example, for COVID, we think it came from bats. We always blame the bat. But the truly incursions into natural habitats with spillover of viruses which have been there for a long time, minding their own business, that gets spilled over to humans in spillover zoonosis, sometimes through an intermediate host, whether it's with human diet, activity, and interactions. We, for example, in COVID, we spilled back COVID to different animals, including the white-tailed deer. Dogs have been infected now, even with what's been in the news recently with avian influenza. Cats and alpacas get infected. And then there's secondary spillover backwards to us. This has been in the news. I think if you've been following what's going on with avian flu and H5N1, it's been in the press a lot, and you might be wondering why all this fuss about it. Haven't we known about H5N1 for decades, and it hasn't taken off to be a pandemic? But in a very unprecedented way, I think while the previous H5N1 outbreaks have initially a lot of Asian clades, over the last few years, it rose in the Americas in bird populations, and the latest clades have made their way to dairy cattle, and that is unprecedented. Cows have not been known to be good hosts for influenza, but it jumped across to dairy herds now, and thankfully now still just only sporadic human cases. But climate change might be making it worse. There's a hypothesis, and people have studied this, that there is a definite demonstration that flu with humidity and temperature and wetness, and this is affected by climate change, can survive in more wetter climates if we have more rain and wetter environments. And then there is kind of a U-shaped type of relationship between influenza viability, how it gets carried by birds, their droppings across different continents, and how that changes with humidity and temperature. So climate change could be very well facilitating emergence of the next flu pandemic. Nearer and closer to home for vector-borne diseases, this year and as every 4 to 5 years, climate change is one of the variables. It's not the only variable, but with the serotype shifts in dengue, but there has been a definite effect with warmer temperature, and this has been studied and shown by different groups, that both warmer temperatures for the Aedes mosquito, both for Aedes aegypti and albopictus, that there is an increase of about 11 to 12% of transmissibility in areas from the decade spanning from the 1950s to the 2020s. In fact, there is about a 10% rise in the vector population when we look at it over the last 100 years ago worldwide. So we are seeing dengue, and we are seeing dengue in places where, in southern China, in areas where it's creeping and expanding in reach. West Nile virus, another arbovirus, has made its way into Europe. Dengue is now in Florida and moving up northwards. And beyond dengue, actually, we're seeing not just viruses, but parasites. And for example, the brain-eating amoeba has gone up as far as Minnesota, which is unprecedented. Another yeast, which is a fungal pathogen. I don't watch The Last of Us, but I think if those of you who watch it, you are familiar with cordyceps and fungal pathogens. That's maybe not too much of a strange scenario, because fungi, and like one called Candida auris, which is a multi-drug resistant yeast, is also making its way and driven a lot by temperature changes because it's a thermotolerant fungus. Food and waterborne diseases are on the rise due to health disparities, so that equity piece, and these are going to affect countries which really do not have good wash or sanitation. Food in Singapore, we're trying to be more sustainable and self-sufficient in our food supplies, but food, your hamburger that you eat, I think comes from probably 50 or more countries with all the ingredients. And lettuce, for example, foodborne outbreaks on lettuce, bacteria can come across in 24 to 48 hours with food importation, and these are not just regional outbreaks, but it can cause multi-site outbreaks in various parts of the world just because of food. And a lot of this is driven by agricultural changes. As it's become harder for our farmers to grow food, we will be depending on antibiotics more, and some of these foodborne and multi-drug resistant outbreaks are set to rise. A soil-borne disease called amyloidosis has also spread now. It's more widespread, and again found to be endemic in some areas, maybe driven also by climate change, and also food and waterborne diseases, like, for example, flesh-eating bacteria by Vibrio. Warmer seas allows Vibrio to thrive, and this has been an issue when the summer gets extended. Antimicrobial resistance is a complicated issue and multifactorial. For example, COVID-19 was we used a lot of PPE that drove a lot of microplastics and microplastic pollution. Microplastics have been known to affect the microbiome, and the microbiome in the soil is actually very important, regulating several cycles, including the methane cycle and carbon dioxide cycles. Those increase in greenhouse gases due to alterations in the microbiome do drive warmer days. Warmer temperatures drive genetic exchange of resistance determinants amongst bacteria. The warmer temperature also leads to more food insecurity because there are less hospitable farming areas, drives more antibiotic use, and these are some of the mechanisms where we would expect to see. So you might have life-saving technology like a transplant where we can do fancy things and save people's lives, but then they die from a complication that we can't treat due to antimicrobial resistance, and so that is sad. So this is my last slide. It's a bit like whack-a-mole. I think I made this slide. I kind of cut and paste. I Googled like burning furnace, and I got this picture, and whack-a-mole, and I kind of put it together. We have been playing whack-a-mole with a lot of these infectious diseases, both diseases which are pandemics that we are fearful of, and things more endemic, and we are waiting for disease X to pop up, which is not if but when. COVID, from SARS 2003 to its upgrade version 2.0 in 2019, took 16 years for its second upgrade. But I would say that we don't know. It seems with accelerating tempo that these diseases are going to pop up. I don't have a crystal ball to tell you when, but I think it will not be long before the next disease X will come upon us. But maybe faster than disease X is that 9-year timeline that Ben talked about. So it took COVID 19 years, but climate change is upon us, so we need to put our hands and hearts together. Yeah, so thank you.
Hello. I think we heard a lot of doom and gloom. So my picture is a bit more balanced. I think that I have to give some hope. I'm an optimist. So I think we have to hope for the best, but we have to plan for the worst. So in terms of having a heat resilient city, I'll share some of our perspective. So I look after research in URA. I also happen to co-chair the Heat Resilience Working Group, which is an interagency group looking at building a heat resilient city. So I think Ben talked about this earlier. Early this year, in January, we released our version 3 of the climate change report for Singapore. And the numbers are tough read. It's quite a sobering number. So the number of heat days, even under the best case scenario where the world gets its act together and everybody cuts its emissions and we can keep more or less to the 1.5 degree thing. Even under the best case scenario, the number of hot days is going up from now less than a month to almost 3 months. And in the worst case scenario where we continue to burn fossil fuels, etc., as per normal, it's almost every day. So, but other than days, I'm also concerned about nights, because the number of hot nights determine whether you sleep well, or you need aircon to sleep. And under all scenarios, the number of hot nights is almost the whole year. Yeah. And of course, the temperatures will rise somewhere, depending on which scenario, from about less than 1 degree to 5 degrees. Yeah. Similarly, you look at the heat stress days, high heat stress days, etc. It also goes up depending on which scenarios. And the worst case scenarios, again, is almost the whole year. The best case scenario, again, is about 3 to 4 months. Yeah. So on top of climate change, basically Singapore has always been a hot country, so we're in the tropics. So it's guaranteed it will be hot. But then you layer on the heat from climate change, and then you layer on the heat from urban heat island effect. So Singapore, we are a city, and we're getting more and more urbanized, and hence the UHI, it's there, okay? But the good news is that with good design interventions and things that we're doing, actually we can remove or even possibly eliminate most of the UHI effects. So I'll talk a bit about some of the things we're doing to do so. And we are starting to see the evidence. I think Ben talked about it, our previous speakers all talked about it, so I won't belabor the point. It's no longer something that's happening in the future, it's happening now. Yeah, so we are really seeing the effects now. Of course, with V3, we project all the way to 2100, and those numbers that we're looking at are closer to the, based on 2050, 2100. So the numbers will get worse if we don't do anything about it. Okay, so what are we doing in terms of enhancing our heat resilience? So basically, we have 3 prongs. So first prong is helping to deepen our understanding of science and how heat affects us in terms of our people, in terms of ecology, in terms of our infrastructure, etc. So we have done quite a lot of modeling and simulation. V3 is one version done by our colleagues in the CCRS. We have done Cooling Singapore 2.0, which is a digital urban climate twin. So Jason here is one of my PI for one of the work packages looking at how heat impacts the demographics as well as the people. We have also done quite a lot of modeling on the other side, which is some of the design, some of the strategies to mitigate heat. So we've done a lot of environment modeling. So now we are actually much better in terms of designing our buildings and our districts, our neighborhoods to be more heat resilient. I mean, we have done things for the longest time. For example, our buildings are north-south facing, not east-west facing. You know. So some of these techniques have been around for eons, okay? But with our data analytics as well as modeling, now we have done a lot more in terms of shade modeling, wind modeling, and we've started imposing some of this. For example, in our sales sites in Lantor, Jurong Lake District, Marina Bay, we have safeguarded wind corridors. Yeah, so there are no build zones, low build zones, and this is basically enabled by science. So HDB has done similarly in some of the new towns at Tengah, where we safeguard wind corridors to maintain wind speed. We maximize shade. Yeah. So these are some of the strategies that have been not just researched upon, but incorporated into our day-to-day activities. Similarly, we are testing out new techniques or new ideas, one of which is cool paints. Basically, these are reflective paints that reflect more of the solar irradiation back to sky. We have done some pilots. HDB, JDC have done it for industrial. MOE have done it with schools. Generally, if you apply cool paints, it lowers the room temperature about 2 degrees. So it is substantial. Yeah. Then other things we have been doing, like greenery, it's also helped us reduce the UHI. And we have, our NPark colleagues have a 1 million tree campaign, and we continued. URA, we also have incentives for developers to inject more urban greenery, vertical greenery with our large program. Finally, we also want to help the people become more resilient themselves. So last year, our colleagues in MSE launched the My EMV app. How many of you have My EMV app on your phone? Oh, okay, a smattering. Okay, I downloaded it last year as well. But actually, I haven't received a lot of heat alert. Most of the time, it helped me plan for rain, you know, whether to bring my umbrella or not. But in the future, it will become commonplace because what you see is the heat stress days is going to be 100 days or 300 days, depending on which scenario. So you will get a lot more heat alert. And then what do you need to do when you have a heat alert, you know, in terms of attire, in terms of drinking water, choosing your activities, etc. So some of these things, we are trying to help the individuals help themselves. Yeah. Okay, so with some of the statistics for V3, then we need to ask ourselves some of the things that we have been doing, you know, business as usual. How do we need to change? So I'm talking more about the adaptation side of the house, because in terms of mitigation, with the Singapore Green Plan, we have already raised our ambition to net zero by 2050. So I think our minister talked about some of that earlier. But in terms of adaptation, you know, regardless of how well Singapore does, we don't know how the climate change scenario will pan out, and even under the best case scenario, it's still a tough picture. So what do we need to do to ensure that our city, the function, the people can continue to remain resilient and can cope with the heat? So there are very basic things, like I think when we look at heat stress, for example, would we have certain hours in the day where we don't allow outdoor work? Or the outdoor work, you have to have very frequent breaks. Yeah, so these are some of the things that potentially are coming. MOM has already have some guidelines. SAF has some guidelines. But the situation where we meet those guidelines will become more and more frequent. So maybe we may have to change our work practices. For example, now construction activities are limited mostly to the day to reduce noise nuisance. We may have to change some of those to allow more hours of construction into the night, for example. So it may affect very basic things in what we do. So for example, maybe we may play less soccer, play more indoor sports, you know, because the number of hours you can play soccer becomes more limited with a lot more heat stress days. Yeah. So now I play soccer every Sunday, 7 a.m. to 9 a.m. So before it gets hot. Yeah. But I see all the little kids playing after us, you know, the sun comes up, it gets very hot. So to avoid heat stroke, maybe we have to change our sports, you know, activities. Do we need to provide more indoor sports facilities, you know, or do we change the hours so we have more night sports or whatever? Would it affect our willingness to walk? So we are planning a city for car light. You know, it not just helps reduce our carbon emissions, but it's healthier. So we have walk, cycle, ride, you know, take public transport, etc. But if it gets very hot, you know, do people prefer not to take a walk, cycle, ride? So that undermines some of our planning strategies. It undermines your health outcomes as well. Then, of course, specifically for the healthcare sector, our nursing homes, I think Class C wards, B2 wards are naturally ventilated. But if you imagine every night is a hot night, then more than half the year is a hot day. It may not be tenable to have natural ventilation. Yeah, so do we design such that there's air conditioning or either some form of hybrid cooling for all the buildings? Yeah, and this includes schools, classrooms, hawker centers, and HDBs. They're all designed to be naturally ventilated currently. But with V3, some of these basic assumptions may have to be reviewed. Yeah, so these are some of the conversations we're having to discuss. And of course, with the higher number of heat stress days, potentially there'll be more patients that come in for heat stress. So I think I'll let Jason talk a bit more about those, since that's his areas of expertise. So as I mentioned earlier, so some of our design policy principles, etc., may have to be reviewed. But the good news is the science has also advanced. I think there's a lot more ideas and things that can be done to make the buildings more heat resilient. Vertical greenery is one of them. You know, I think for the hospital settings, there are many other technologies can be done. You guys have set up new hospitals that are super low efficient building, and the standards for those buildings have continually gone up. So things that used to be gold mark, green mark platinum now are actually only green mark gold. So the standards have gone up every few years by our BCA colleagues, and I'm glad that our new facilities continue to meet the new higher standards. Yeah. So there are many possible scenarios, and this is over a very long time frame. As I said, the V3 goes all the way up to 2100. But I think I agree with Ben is that we need to take action now. Basically, we can't afford to wait until 2100 when things are already in such a bad state. So whatever we can do now, I think the government is one of the key stakeholders, but individuals, society, organizations, you know, are all part of it, and we all need to do our part. So how do we continue to change, to take into account some of these climate change scenarios, and of course the implications that have been talked about from the climate change scenarios. Okay, that's it. Thank you.
Still want to, if I may, because I'm freezing. Yeah, you saw me fidgeting. I was trying to increase my metabolic rate, you know. And research shows that if I feel cold right now, most of our female colleagues will be feeling even colder. Most of the research has been done predominantly in white Caucasian men, so we need more data on females and from Asia because thermal comfort is very specific. We have entered into the new phase. I don't have to elaborate. It's no longer climate change. It's climate crisis. It's no longer global warming. It's boiling. The problem is extreme heat affects the humans more than the infrastructure. Humans can be more forgetful than you think. We talk about it. We complained just a few weeks back in April that dome came to this part of the world. It has moved to other parts. You know. If we don't take actions, we'll keep on complaining. I tell you, our leeway is getting tighter. It's not just about heat, the humidity, the chronic heat exposure. It has changed our behavior. Singaporeans are not tropically acclimatized. There's a wrong assumption. I spoke with my counterparts overseas. So you guys living in Southeast Asia must be very heat resilient. Look at us. I know we are very good in wearing jackets in cold environment. We tried to. There are still some gaps, so help me to fill the rest of the gaps and the problems and the implications we are experiencing in our parts of the world. It's not just morbidity, mortality. I think for the longest time, we have mapped that and said, hardly any death, a few deaths. I came from a military background, spent a lot of time looking at heat measures for the armed forces in occupational setting, firefighters, law enforcers, sports settings. It's a different context altogether for those of us who don't need to compete, we don't have to fulfill a task, and we think that there is no problem. I listed a few. Have we quite linked myopia, lack of physical activity, incidental physical activity in this case, all because of the uncomfortable environment outdoor? Uniquely, we talk about human health and well-being, right? Often it goes to the 3 pillars: eat well, sleep well, exercise well, right? You appreciate heat, suppress, exercise ability outdoor. Now we know that best case scenario, every night will be a warm night. You thought that I work hard, at least now I can rest. You probably had aircon, many don't have. Now, not many are aware heat also affects how you eat. Often those who are a little bit on the heavier side, we ask them to go for a swim, right? They say, hey, I swim every morning. 6 months back, they say, I don't think I lose a lot of weight because they eat very well after the swim. Remember, in my younger days, you know, the mee siam and the fishball sold very well in the swimming pool. You don't see those stores at running tracks. Look at that. So I also want to give heat a good branding. I use heat correctly. It can be a eustress and not a distressor. So here we are positioning heat always at the back thing. Since it's free for us, we need to be creative and see how we can use heat. If tomorrow we publish a paper that said 3 times 20 minutes at noon walk makes you more beautiful and handsome, right? Trust me. I know. Next day, you see a lot of people walking around at noon. I have a soft hearts for the pets. Have we talked about the pets? Talk about One Health, not just the environment, humans. How about our pets? Do we need to derive experiments evidence to say that huskies should be banned in Singapore? If husky can talk, he's not barking, he's cursing at you. Okay, I have no time to go through each of these. I got to go to my final slides. I think we need to allocate resources to the most vulnerable, and we are. Look at this, in Project Heat Safe, funded by NRF, we went around, not just in Singapore. Today, we have 2 citizenship, yeah? I know those of you who are Singaporeans, you are Singaporean. You also have a global citizenship. From a societal perspective, even from economic perspective, we are not a loner, we are a function of the world. We are so well connected, we know about that, right? So don't see food security as one problem and human health or agriculture workers another problem in face of heat. They intertwined. I was in Isan, the northeast part of Thailand, Khon Kaen, slightly out. I was there and the farmers look at me and say, are you here to give us solutions? I said, no, I'm here to warn you, if you don't take care of self, you might have poor life quality thereafter. He smiled at me and said, young man, I don't care about my life quality 20 years. I need to bring the bread and butter home this evening. I will take the risk and I'll go out and pluck as much as possible because my family needs that. Also, I ask as we undertake this, we'll undertake with empathy. We are the fortunate one. If you sit in this room, it belongs to the very fortunate one. There are many out there who are struggling. So Singaporeans and the like. And the thing outside Singapore, and we can, I wouldn't say cut and paste. A lot of things work in Singapore are not workable outside Singapore. But the principles and methodologies and considerations, I think, are scalable. If you don't do beyond, then we're going to pay the price in many ways. The picture in the center, we went to South Korea, the delivery workers. The condition then was 20 degrees Celsius, the mildest amongst all the other contexts to quantify. But they were most strained physiologically. Heart rates about 130 plus, core temperature mid 38.5. That is the degree of how an ultra marathoner would exhibit when you run an ultra marathon race. These workers had that kind of physiology every day. So not rocket science, at some point, the physiological system would be stressed and they will pay the price. So it's not just about a hot environment, that's my main point here. It's about a hot human body. So don't assume when it's not hot, humans are safe, yeah? Because the other two factors, clothing and the metabolic rate, are key driver in determining how hot you get also. So it's more sophisticated than that. As you go about doing modeling from district to buildings, I tell you, if you go now to the apartment, there lies an apartment that is a akong, ama, young fit man, or a child. The common advisory will not be sufficient for every one of them. So it's going down to very specific, very personalized. And finally, if I make it, since this is a healthcare folks, right, I think that is scope for us to waive traditional medicine. We talk about qi. My understanding is qi is what we are after, and that the balancing of yin-yang is important. We can go about deriving evidence and say that when it's hot, you better take cold shower and cold drinks. You know how powerful your grandma is? You say, you are wrong again, young man. When you're hot, you shouldn't be taking cold drinks. See? And also the fusion of TCM or traditional medicine as a whole and Western medicine should come together because they don't need various advisory. And certain advisory can contradict. When pollutants come, what do we say? Close the window, don't let those things come in. When the hot environment, we say, open out the window, more ventilation. Don't confuse our vulnerable population. They need one common advisory. So it's time for us to fuse all these stressors in the society and give them the right kind of advice. Thank you.
Well, thank you very much to all four speakers. I think they've given you a spectrum of insights today. I particularly like what Jason mentioned. All of us here in this room are very fortunate people. Probably many of us drive cars with air conditioning. We're here in a conference listening to insights, not working out in the paddy fields, plucking vegetables and so on. But I would want us all to take a little bit of time to think, if we are so fortunate, what could we do in the workplace, in our professional roles, to support this issue of dealing with climate change, so that we don't leave the two-day conference sort of as this was fun, this was interesting, and then we leave, and then we go back to our daily lives and continue to do exactly what we did yesterday. So I hope the conversation that we're about to have will leave some of these thoughts in your head for many more days, and hopefully not many more very warm days. Now, I'm going to start with a question for Benjamin. Why do you think that Singapore, and in particular, I think Singapore healthcare, why do you think Singapore healthcare could play that role on the global stage? Now, a lot of Singaporeans are taught from young, we are a small country, we're a victim of whatever's going around in the world, we don't have natural resources, we need to mitigate. Why do you think that Singapore can play that leadership role and take that action to lead by example?
Singapore needs to play a leadership role. That was why I came to Singapore 6 years ago, was to play a leadership role on climate. And in December of last year, the Ministry of Education gave myself and the Earth Observatory of Singapore, for which I'm director, the largest single grant in MOE's history to start a climate transformation hub for Singapore, to have a look at the impacts of climate change in Singapore and Southeast Asia, in biodiversity, finance, and in health, monitor it through remote sensing and AI, and then try and find solutions, particularly in terms of natural solutions, in terms of regeneration of corals and our tropical rainforests. Why are we responsible? Well, you know, I've worked in a lot of countries in my career, and I would state that Singapore is the most susceptible developed nation in the world to climate change, because you've got nowhere to go. You know, I said this statement before, that Greenland and Antarctica have 65 meters of sea level within it. Well, a third of Singapore's landmass is only 1 meter above the highest tide. So you're very, very susceptible to sea level rise, and we've talked a lot about the impacts of heat. So you're very, very susceptible. So there's a reason to do it. The second element is your responsibility to the region. Southeast Asia, and perhaps for the tropics. There's obviously a huge amount of innovation in the healthcare. I can see it written in front of me, but that's because of the investment by the Singaporean government in R&D. If we think about the two major universities, NUS and NTU, they are the only universities in the whole of the tropics ranked in the top 50 in the world. NTU's ranked about 15 and NUS is in the top 10. So you have a great deal of responsibility because of the huge investment that you've put into it. And then the third reason for responsibility in any sector, whether it's healthcare or in aviation or in maritime trade, is that you are also within the coral triangle, the highest diversity in the marine realm, and you're also in the center of huge tropical rainforest belts. So you have huge responsibility to make sure that the natural ecosystems remain intact. That's important for biodiversity, it's important for carbon, it's important for the infectious diseases. So the responsibilities, I think, are threefold. One, it's for your own futures. I'm a parent. You know what gets... There are lots of reasons I do this job, but the big thing that drives me is my kids. I have to leave a world where my kids are happy and healthy. And if we don't solve climate, they won't be. So you're responsible for your children, people who you love and you care about. You're responsible because Singapore's put so much money into R&D that you've got to help support those less fortunate around you within Southeast Asia and the tropics, and we can't forget about the natural world.
Thank you very much, Benjamin. I think that was a great reminder that we have to play that leadership role. Now, there are a couple of questions around air conditioning. I think people are asking, you know, if we had to deal with heat stress, why not we put on the air conditioning, put them in long-term care homes, put them in hospitals, maybe put them in schools. If I can ask Wen Tong, how do we break this cycle about having to use air conditioning and then knowing that the air conditioning actually is energy intensive?
Okay. Actually, yeah, I do agree. I think LKY did say air conditioning is one of the greatest inventions of the 20th century. I mean, from a thermal comfort point of view, productive point of view, you know, he's not wrong. But for me, when I look at heat resilience, air conditioning is not just use energy, but it basically just ejects heat from the indoors to the outdoors. So it makes your outdoors hotter. So it actually worsens the problem for urban heat island. So it's a tough call. But if you look at the number of hot days and hot nights that are coming, maybe it's inevitable. But having air conditioning itself, can we do it better? Like I said, today I'm feeling cold wearing a shirt, a short sleeve shirt, but this should be the norm. You know, we should set our air conditioning at a high temperature. There have been research done by our colleagues in BCA, whereby, you know, if they have fans, you can set your aircon at 27 degrees and it feels like 24. You know, there's other research where, you know, they pump the air to your cubicle. So you don't cool the whole room, you just cool the cubicle. And then now a lot of us work from home, maybe with a hot desk, you only turn on the cubicles that are occupied rather than heat up the entire office. So there are many strategies whereby you can do it in a smarter manner. And I will even go further upstream. Can you reduce the air conditioning load? So if you design your buildings in a climate sensitive way, you know, more north-south facing, more self-shading, you have cool paints or solar panels or greenery on your roofs and all that, you reduce the heat load of the building. Yeah. And I'm also in favor of strategies that have multi-benefits. So greenery, for example, I'm doing research on the impact of the built environment on well-being, and greenery has been proven to help, you know, your recuperation and all that. So if you have strategies that provide multiple benefits, then we should improve and increase that. So we have strategies on planting pallets, you know, how to do vertical maintenance. We have incentives for developers to do vertical greenery, so we should do more. So some of these things, in a way, I feel it's no-brainer lah. But aircon, it's both a boon and a bane. So I don't think in Singapore, if you have no air conditioning, I think we will all complain. You know? But how do we do it in a smart way? Yeah, thanks.
Thanks, Wen Tong. Now, changing focus a little bit onto the doctors, there's a question around how do we reconcile infection control and pollution and climate change? And if I could ask Sean to address that and maybe take that together with the question about incentives. How do we incentivize healthcare professionals in their everyday jobs to think about climate change? Because everybody's very, very concerned, rightly so, about patient care, about infection control. But within the healthcare system, how do we put in place incentives so that people have to think about sustainability and climate change?
Yeah, thanks very much for the question. So, healthcare, I think in the estimates, contributes to about 5 to 8%, depending where you read, of the greenhouse, the carbon footprint. Just taking an example of PPE, I think a question about infection control, and COVID is a case in point. I think when we had a new disease where there's a lot of uncertainty and even not too sure how it's transmitted, droplet, aerosol, or fomites, right? So the initial PPE stance, or the personal protective equipment, was a more conservative one. It was level 4A, MI level 4 gowns, eye protection, sometimes headgear, gloves, and that generated a lot of waste. On the 27th of September 2022, actually after the pandemic, I think this culminated after discussion and seeing how we know more about COVID. The virulence had changed, we had countermeasures. We appropriately as a country stepped down our PPE. Right now we use N95 respirators. Actually, a lot of us are also asking whether we can just use good old surgical masks. But that came after discussion, and that was an example of how middle and ground-up initiatives, together working with the National Infection Prevention and Control Committee and MOH, we kind of looked at the situation. Right now, the virulence of the disease has gone down. We know much more about COVID. There are vaccines, and the disease severity is not as bad as initially. And I think we need to change some of our dogmas and the way we practice infection control. A lot of times we are very good at starting things, but we are not very good at questioning dogma and stopping things. A lot of pathogens, we just look at the biologic basis and we say, for this pathogen, just put this on, but we never look. It takes people to want to question, do we really need this? And a lot of things are rolled out in a bundle, so you're not too sure which part of the bundle really is the most effective part. So, for example, we just look back at our data. The data is not published. We were one of the first countries. Actually, I've spoken to people who visit NCID, and when I meet people from other countries, I keep asking them, what are you putting on for COVID? A lot of countries have started to roll back, but officially, neither the ECDC nor the US CDC actually has stepped down their stance on PPE. It's still the full entourage. But we, in September 2022, so we've had a years of data, we just look at data in NCID and Tan Tock Seng, and we found that we saved about 400,000 gowns over a space of a year. The number we used about, we looked back and we had to do some back calculation, and we actually pulled the total number of just gown usage. One gown generates about 905 grams of CO2 equivalent. And putting all that gown together, each patient room for a COVID patient averaged about 11 gowns a day. And when you multiply that by the number of patient days for COVID, we saved about, in terms of carbon footprint, and this is preliminary data, about 150,000 kg of CO2 equivalent. So this is quite a fair bit, and this is just one center. And if you take that, so some of the, there will be a multiplier effect. So I think we do need to question some of the dogma that underlie some of the infection control assumptions and be ready to adjust. I think the other question is looking at how we incentivize folks. I think we need to share, I think one of the opening panels, we talked about putting it into our way of thinking and to enculturalize it, I think, and to celebrate successes and to demonstrate impact. Certainly the healthcare workers now, our nurses and doctors were really happy because data has also shown that patients in a lot of PPE requirements and isolation tend to be neglected. Actually, healthcare workers walk into their rooms less, and they usually sorry, but a bit forgotten because it's troublesome to put PPE to go in. The nurses and doctors were happy, the healthcare workers, because it took less time to get in and out of rooms. So I think these were all collateral benefits. So I think when we roll out an initiative like this, we do really need to share not just, maybe people are not so habituated to think like, what does 100,000 tons of CO2 equivalent mean to me? But we need to translate it into a language and to share that success, and also to some of the initiatives where it has demonstrated impact on their day-to-day work. I think those would be powerful incentives, and it takes both, like the other speakers said, probably not just policy, but to listen carefully to ground-up suggestions, and also the leadership. We must not be, as leaders in our professions, we cannot be the ceiling to impede some of this. If we should also take the lead, so it's multi-pronged. Yeah.
Thanks, Sean. Well, I guess maybe the not so polite way to have asked that question would be, at which point would we in the healthcare system put in punitive measures to stop people from doing things that harm the environment? I think maybe in climate change, we often talk about incentives, celebrate success, give out awards for good ideas, but perhaps the real change at some point comes from saying, stop doing this, and if you continue, there are punitive measures instead. Question is out there, who is ready to take that first step, and how do we say what is unacceptable versus what is acceptable? We have time for one more question that I will pose to Jason. You do a lot of research, and you talked about populations, different segments, and so on. Singapore often is very obsessed with this idea of we're an aging population. The national narrative is about coping with an aging population. How do we ensure that the focus doesn't shift too far away from climate change? You mentioned the topics are related, but often the topics not talked about together in the national conversation. How do we tie both aging and climate change into the same story so that we deal with it comprehensively?
Thank you. First, it's not age per se, but it's correct to say that as we age, right, your physiological capacity is usually not as high, and therefore any stressor, may it be heat and other stressor, the individual who is not so strong will get hit more. So it's a function of not just the stressor, but your adaptive ability. So on that note, right, before the pandemic, we asked you to exercise for good health. During the pandemic, we asked you to exercise for good immune function. Now post-pandemic, in face of a warming or boiling world, I ask you to exercise. So not very demanding, still ask you to do one thing, but now you see that one thing is so good for many things. And heat, interestingly, is a stressor. As I said in my earlier pitch, that it can be a eustress. Think of it creatively. Exercise is about creating a kind of strain. With recovery, you get stronger. You exercise 7 a.m., probably you need to exercise 40 minutes to raise your heart rate to a certain range, 140 beats, let's say, for example. You exercise at 11 a.m., maybe half the time you can achieve the benefits. Plus the vitamin D, good for your eye health, mental health, yeah? So use it, because the window of that comfort zone will only diminish. So if you don't start to learn how to use heat, right, you will be compromised. Before I answer that also, I also want to make a call for aircon. I think aircon is one of the greatest inventions. Okay, the problem is the allocation of aircon is totally wrong. I have a 16-year-old girl, right? Occasionally, I will see her wearing her hoodie in the room and turning down the aircon and say, "Pa, it's very comfortable, you know, when it's cold, you wear the hoodie." 2 weeks ago, I went to NUH hospital wards. I see oncology patients not having aircon. I said, this is totally wrong. That little girl should be punished. No, not the patients in these wards. I even dare to ask the healthcare workers, immediately based on the body language, I knew that she was uncomfortable. I asked her, do you feel terminally uncomfortable? She looked at me. I said, I know what you mean. And then later she showed me there's one spot at the corner where they have 1 times fans that cool them down whenever they want to get a respite. So I think it's an allocation of resources. We talk about punishing, right? You know, remember just in recent years, I think we tried many ways to teach and hope Singaporeans will return the tray. And what worked eventually? Fine them, punish them, and they work immediately. Maybe that is good for that also. So coming back to the aging population, I think there's a need to go back to medical school. How many of us here are aware that medications we prescribe, some of which can compromise thermoregulation in the form of lowering your heart rates? You want your heart rate to increase to vasodilate, to push the heat to the skin. Are you aware some antidepressant might affect your ability to sweat? Have we taught the medical students about this? Because they were one that's seeing the patients. Many years back, I'm a fellow of American College of Sports Medicine. We coined this mantra, exercise is medicine. Sounds right. Technically, it's wrong because exercise is better than medicine with no bad side effects. But anyway, that is fine. But it took years later for us to discover this work. This came out by the group of exercise physiologists like myself. But I don't prescribe medicines. The physicians do. So we almost like impose this obligation. They say, hang on, in med school, the most we can do is to go exercise. But intensity, frequency, duration, that is not taught in med school. Therefore, every summer, you see humans are being killed in global north, right? They die of classic heat stroke. You think they died because they get cooked? No, many of them had existing cardiovascular, cardiorespiratory conditions. Any stressor would tilt them to the other end and they pass on. I presume a lot of them had medications. Do the physicians who prescribe the medicine say, hey, you got to eat this, but summer will come, and therefore there are certain heat measures you should be aware of. Also, it's important as we prepare for the aging population. I think if the default solution is build more hospitals and get more healthcare workers, right? I think that would be a bad option. And like we all agree, right? Let's find a way to prevent them from coming to hospital. Cooling centers, the kindergartens that don't function over weekend, can they be turned to cooling options? You know, say this Saturday will be hot, the uncle aunties prepare the mahjong set, some tidbits, and say, see you downstairs. Make it convenient for them. Don't assume you give aircon, people use aircon. We learned from the big Japan heat waves. Many died. Most of them had aircon. They didn't use aircon. Why? Because they have to pay the bills. Government is happy to pay the bill in this case for sure, because if they don't, they'll end up in hospital. It's more costly. Same thing, I go back to the example of patients in hospital. Is it costly? If we have data to say the poor recovery that made them stay longer in hospital and the morale of healthcare workers, you find that it's very cheap to provide cooling options. Not necessarily aircon. There are other cooling options available, cooling blankets, fans. It's a good, put a fan, but we didn't. So we have to design it. You'll be surprised. People don't put a fan. It could be as simple as because it doesn't look nice in my home. So consider that at the first phase when you design your homes. So go upstream as much as possible. Don't be reactive. Prevent those ill patients coming to you. I'll pause there.
Thank you very much, Jason. And I thought at this point, let us thank the panel. They've given us, I think, a broad range of insights. I think they've shown us why the problem is so critical to be dealt with today and not tomorrow. And also, I think Wen Tung has given us some optimism about managing heat stress. I think the message that the panel would want to give all of you here today is think about climate change actively in all of your professional roles. And like Sean mentioned, question why do we do what we do today, question whether or not we have to be doing this again tomorrow, and be courageous to tackle climate change for the sake of your kids and for the sake of Ben's kids as well. So thank you very much, everybody, and thank you to all our panelists.
Thank you.
Thank you so much to Jasmine and our wonderful panel here.
Ben, thank you.
Thank you very much. Thank you. So, as our panel returns to their seats, I'd just like to come back to a point we made at the very beginning of the morning. And don't worry, we know you're all hungry. It is nearly lunchtime.
Yes.
Before we take you out to lunch, we'd just like to share a little bit about what we're doing to really practice what we preach. We aim to be an event with strong sustainable practices and certainly trying our best to improve upon previous efforts. And we would encourage all of you to take your part as well. So you will notice the CHI Kaizen team has left some nudges around the building. I'd like you to look out for them. And please, I encourage you to be like me and drink from the toilet. Here we go. Delicious. Washroom water. Many people turn their nose up at it and think we need water from the cooler, but do we really? Absolutely fine to drink water from the washroom. There are nudges there. Take your bottle, refill it, and be hydrated all day. You'll notice nudges as well at the lunch queues where you're waiting to get your food, and some little thoughts there around how the food you're eating is creating a bit of a carbon footprint.
Right, so if you can open your virtual ticket, click onto the CHI Carbon Calculator tab now. Could we do that, please? You'll see that also on the screen. Can we go back to that? That's right, the QR code there. So this is going to be our attempt to calculate the carbon footprint of today. There'll be a few questions that you'll have to answer on your practices and habits, and then we'll try to do that calculation from there. And at the end of the questionnaire, when you finish, just try to screenshot your results for reference a little bit later on, all right? So scan the QR code, answer the questions, take your time over lunch to do that as well. We will close the poll after lunch, and we'll give you the results a little bit later on as well, all right? If you have trouble accessing the calculator, do refresh the page on a different browser as well.
So we're looking forward to seeing that. Don't forget to do it. Just a reminder, it's not just food you can look forward to outside. The food will be served on level 2. We also have right outside the auditorium, here on level 4, the cataract waste exhibition, where you can see what the TTSH cataract team has done to the waste that comes from surgery there. And then down on level 2, whilst you're getting your food, you can also have a look at the sustainability showcase in the exhibition halls, as well as the 30+ exhibition booths there. And you can even have time for a lunchtime talk hosted by HOK's design principal himself, Mr. Jeff Kernell.
There's more. So if you're interested in what the design of sustainability looks like, while this conference has been happening outside in Kampong Square, we've actually been running an innovation challenge for healthcare sustainability, brought to you by CHI and our great partner, Singapore Institute of Technology. So we'll be sharing more about this at the later part of the conference.
Yes, so I'm seeing a lot of people on their phones, and I want to believe it's because you're all busily, all the faces, how did I get here? What is my carbon footprint? Okay, we're looking forward to finding out about that after lunch, but let's go eat some food and refresh ourselves. Perhaps we could invite our VIP guests to follow the ushers out now, please. Down to level 2, we have a VIP space for you to eat. And in fact, all food is being served down on level 2. So as our guests take their leave, we'll invite the rest of you to also make your way down to level 2. And don't forget to fill in your carbon calculator. Okay, I think that's it. Thank you for an amazing morning.
We'll see you after lunch at 1 p.m. See you all.
Thank you.